It's prepping right now. Let's give it 1 second.
Okay.
All right, we're live.
Okay, good evening, everyone. The hour of 6:30 now having arrived. On this 31st of August, 2021, I will now call to order this special Common Council to address issues of COVID. The first order of business after the call to order is the Pledge of Allegiance. So as you are able, if you could please join me in rising and facing the east, and we will do the pledge. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. Thank you, everyone, for that. We'll now move to the public comment section. Before we do, I just want to thank everybody for making time for this special and timely council meeting this evening. Special thanks, by the way, to our staff and council members and members of the general public who may have been running around tonight with open houses around Racine Unified and other schools that begin in earnest tomorrow. So thank you to them for making yourselves available and being flexible with us tonight. Amber or Tara, whomever would like to, we will move to public comments. If we could start by reading off the procedures for public comments.
Of course. The public comment segment is an opportunity for citizens to speak directly to the Common Council. Speakers will limit their remarks to 3 minutes. There shall be no dialogue or interaction between the speaker and elected officials or staff. This time is not intended to be a debate or discussion. The Common Council shall not hear personal complaints or attacks against any city employee or elected official or any matter related to an individual claim, citation, appeal, or lawsuit. Profane, disruptive, threatening, or conduct that otherwise impedes the safe, orderly, and effective conduct of this Common Council meeting is equally unacceptable during the public comment period, as it is during all other portions of city meetings. When a group of people representing one viewpoint wishes to address the council, one person shall be appointed the designated speaker for the group. Candidates for public office may not use this opportunity to campaign for office. Speakers during the public comment period shall follow all rules of the Common Council and rulings of the chair, including a decision to terminate the remarks if the speaker does not adhere to these rules. Public comment shall be limited to ideas or concerns regarding the city of Racine. There will be 17 speakers this evening.
Okay, then let's begin.
Our first speaker is Teresa Johnson. Find her on the list.
I'm right here. Can you hear me okay?
Yes, we can.
Okay, thank you for this opportunity to talk with the Common Council. And I want to speak in support of mandatory masks for the city of Racine. I realize this is not a popular view. However, based on the number of individuals, number one, who are not vaccinated, and number two, who cannot be vaccinated, and then number three, who may have had chronic conditions or be immunocompromised, this is one simple way that we can protect the citizens of our city. So I understand there's many people against that, but I really think it's important that we protect those who don't even have the option to protect themselves, and that's especially our children. And that's all I have. Thank you.
Thank you very much. Amber?
Yep, our next speaker is Jody Atkins. I do not see her logged in yet, so we'll move on to Justin Burdick, who I do not see. This next up would be Keith I'm going to say this wrong. I apologize. Garofalo of 3614 Erie Street.
That was pretty good considering. So can you guys hear me, by the way?
We can.
Okay. Yeah, Garofalo is good, but Garofalo works as well too. You can kind of say it either way. Again, I'd like to thank you guys for the opportunity to speak. I think it's very important for the public to be heard on these matters because the public are the ones being affected by this. I want to start with saying that I know that all of you are really trying your best to do the right thing, and all of you have the best intentions in mind and are really trying to sort out, in this time of confusion, what you can do best for your community. And I applaud you for that, and I thank you for that. My concern is that what is being considered best right now for the public is really not well, there's no consensus on what the best practices are to really keep people safe. And there's a lot of ways to mitigate risk when it comes to dealing with a respiratory virus. I am a resident of Racine. I'm a local business owner. My business is in Mount Pleasant. I work in healthcare and I have a lot of experience dealing with respiratory conditions, understanding immunology, understanding microbiology, and these types of things. So I think it puts me in a special place to really speak to this. But basically, the long and short is that there is not a consensus on the effectiveness of masks. I don't want to debate that with you. We're not here to debate that. I actually sent out an email with peer-reviewed articles kind of speaking to this lack of consensus. And I see right now somewhat of a heavy-handed approach to tell people the best way to protect themselves. And we're also setting up a situation where there's good opportunity for people to be discriminated against. There are people who do have legitimate medical concerns, not allowing them to wear a mask, whether it be physical due to asthma, bronchitis, COPD, things like that, or whether it's emotional trauma. And you're setting up a situation where you're both making business owners police a situation on wearing masks and setting up people to be discriminated against medically. So if there's a policy like this, there should be some way written into the policy that allows people to not be medically discriminated against. And if they have medical reasons to not wear a mask, then that should be approved. And people have a right to their privacy and they have a right to not be asked about their medical status. So that's going to be a difficult thing for people to traverse. I've got a really quick second here. So I'm just going to say that, right now the people are looking not to be parented, but to be supported. And a mandate like this really looks more like parenting and telling people how they should take care of themselves rather than allowing them to do so. People are smart and they will protect themselves. The last thing I want to leave you with is a quote from Benjamin Franklin and or Thomas Jefferson, depending on the source you look at it. And it says, "Any society that would give up a little bit of liberty to gain a little security will deserve neither and lose them both." Thank you.
Our next speaker is Tiffany Julian, 333 Lake Ave.
Okay, I'm here. Let me know when I can start.
Sorry.
Okay.
Yep, you can start.
Please begin.
Here is what I had written down. The last year was not easy for members of our community for several reasons. However, our community can surely do two things at once. Those two things would include both supporting our hurting community members while still remaining level-headed and focused on the facts. When it comes to the children and COVID, the facts are on our side. Here are some basic facts. The World Health Organization study suggested children between 5 to 11 years old were significantly less protected by mask wearing compared to adults. Children are not doctors. They are not lab techs. It is laughable to expect children to be able to follow the basic mask hygiene protocol that adults in the medical field are trained extensively on for years. As all of us saw how dirty our children's masks were last year after each day, from the constant touching, wearing them to the bathroom, sucking, chewing on them, eating with them, you get the idea. A January 2021 study involved 100,000 students and staff saying 99.96% of children do not get COVID from school, which is why schools were considered some of the safest environments to work in last year. And we can thank That fact, not masks, for our children being in the school the majority of the last year. A study of 40,000 people in Iceland found that children under 15 were about half as likely as adults to be infected and only half as likely as adults to transmit the virus to others. I only have a minute left, so I'm going to skip to the bottom of it. But my own child, for the first time, wasn't excited for school this fall until I told her that it wouldn't be like last year, that her eyes lit up knowing that she didn't have to wear one this year. She loved school, but she hated wearing a mask. We should take these children who have problems with masks seriously and not allow emotional people to discriminate against them. According to real studies, masks pose more of a health risk to the majority of children than COVID does itself. The bottom line is some people are in higher risk groups when it comes to this virus. Young, healthy children are not. We have had 500 and some odd days to learn that. Yes, it has been that amount of time since the first government mandate, and some people in this room still think we have given cotton masks enough time to work. It is the responsibility of individual parents to make health decisions for their child based on their individual child's personal health. Some people are allowing emotions to rule, which is fine, so as long as it can rule their own life and not my child's life. A school cannot be run by emotional people because emotional people make bad decisions. Wear a mask if you want to. I stick to the facts, and when it comes to children and COVID, the facts are on our side. Thank you to superintendent and school board members for creating a comprehensive.
Ma'am, if you could please conclude your remarks, your time has expired.
Okay, and that's basically it. That's the end of mine.
Thank you.
Yep.
Our next speaker is Melvin Beversdorf of 149 South Main Street, Burlington.
Hello, can you hear me? Hello, can you hear me? Thank you. Hello, I'm a father, teacher, and a concerned citizen with students in the district of Racine, the city of Racine. I just wanted to mention 2 amendments possibly to the face mask proposal for the ordinance 1321, part 1, section 5435, section 5. Think about changing the language to repeal the continuation of this ordinance to be effective immediately, not waiting for the Common Council to meet again when it was convenient to do that. That would show that your willingness to follow the rationale of your thinking and putting in this mandate or this ordinance. Let me be more clear, not an order or mandate. This ordinance, which is more long lasting. So just a consideration for the council. Secondly, in part 2, section 2 exemptions, part I, change the children aged 4 years or younger to ages 19 or younger. As the statistical data from Wisconsin Department of Health has 0.0% death in ages 0 to 19 school-age children listed currently on their website. In my perspective, laws would be objective and clear. There's quite a bit of subjective language in these proposals, such as the whereas, the last one on page 1, in addition to being fully vaccinated, wearing a mask or face covering is the easiest and most effective way to protect and keep businesses open, the economy. There's a multitude of research about the ineffectiveness of masks and other negative side effects, as you heard from some speakers already, about children and learning. The CDC has their own ranking on masks, around 40% sometimes. Vaccination can go from 38 to 92% effectiveness. And so it shows, again, that there's all these different perspectives on that. Hand washing, of course, has been proved to be more effective than masks. Even Forbes wrote a recent article citing worldwide research on the ineffectiveness of masks. European countries don't wear masks in schools, many of them. It should be kept a personal decision. The United States, being a representative government, goes consent of the governed. Again, did you do your due diligence and ask the governed that you're representing? Get the data in your population. And as for me, I don't give my consent for this, so I don't agree with that. Governing body should do the least harm to the children, especially the children, and it's a moral imperative and obligation to provide the best learning environments. Issuing further constraints upon people could help, is linked to anger, anxiety, depression, and even worse, and does not help our economy, in my opinion. Honest government that truly represents people is needed. If you can think for a moment, how would you like the governing group to rule when you don't sit in those seats as the Common Council? Right now, the harm rate of vaccination is 6,789 dead from vaccination. that's on the the CDC site as of today. So that is a risk that you take when mandating that in the part 2 of your meeting tonight. So I urge you to make mandatory vaccination or weekly testing. On that order, I urge you to add a religious exemption. There are some people who just cannot consciously take vaccinations due to the use of aborted babies or fetal tissues and testing. It's your job to serve and protect, and I ask you to do your best. In the end, my personal faith allows me to choose what I want to choose, and I pray that you consider what you would like for the future.
Thank you very much. Amber, our next speaker.
We have exhausted our City of Racine residents that I can see on here, just so you know.
Okay, thank you.
I think the next speaker I see on the list, where did she go? Is Tammy Malalak, 1311 Timmy Drive.
Hello, can you hear me?
Yes.
Okay. I have never, ever been given a prescription before by a doctor, and I'm told now that Dottie Bowersox is not even an MD or any other person that I have never seen without even the option of a second opinion. How have we all become patients of Dottie's? How did the entire city become a hospital? There was no process. I get to vote for one member of, and that's RUSD. In my vote, I voted well, but that didn't stop child abuse from being mandated. I would like to see some due process. I would like to see a public debate, not just these public comments that are going to be brushed off as you rubber stamp this ordinance in. I want a real live televised debate with experts from both sides or all sides of the issues, discussing the things that are definitely not settled, like do masks really work? Is there actually an emergency? Is the PCR accurate? Are there other treatments available? And how well does the vaccine work or the mask work? We have gotten to the point where debate is considered dangerous. This is not what the US or Wisconsin constitutions support. This is a totalitarian freight train bearing down upon us all. What's next? Last year, we were told mandatory vaccines were a conspiracy theory, as were the vaccine passports. Max Blumenthal, hardly a right-wing conspiracy theorist, reports today that Israel and Australia have announced that its citizens must be vaccinated twice a year indefinitely. Passports already exist in California, New Orleans, New York, Summerfest, and will become a permanent feature of life with indefinite boosters, establishing a social credit system in which participation in society is conditioned on behavior, including getting vaccinated. Who has introduced guidance on blockchain-based digital vax passports? This is forever slavery. It started with the mask and it can end with the mask. Look down the tracks at that freight train heading for you and jump off of this totalitarian insanity. That's all.
Our next speaker is Susan Toller, 1543 Prairie Drive.
Okay, thank you. Vaccinations are a personal conviction, and city employees should be free to make their own choice without coercion. Am I being heard? Okay. Am I being heard?
You are being heard, ma'am.
Thank
Please
you.
proceed.
Vaccinations are a personal conviction, and city employees should be free to make their own choice without coercion. Some employees are concerned because the current vaccines lack full Federal Drug Administration backing, only carrying an emergency use authorization. There are concerns for unknown long-term adverse effects. Research from Oxford Academic, Washington University, Southern California's Keck School of Medicine, Cleveland's Department of Infectious Disease, and others concur that if you've had COVID-19, you have long-lasting antibody protection. Ali Elabadi, Associate Professor of Pathology and Immunology from Washington University, explains that although antibodies do wane after the COVID-19 infection, they plateau. They don't go down to zero. He says these cells live and produce antibodies for the rest of people's lives. Another study out of Hancock, Indiana, shows a person who's been vaccinated after having COVID-19 has to deal with 2 to 4 times more side effects. Being vaccinated does not prevent a person from getting COVID-19. 3 studies paid for by the National Institute of Health, whose conclusions have been ignored, state that COVID-19 as a viral respiratory infection has aerosol particles that spread, even though through the best masks, causing people to share the infectious pathogens, even though the person who's the carrier may be asymptomatic. Since vaccinated and unvaccinated people can both get and spread COVID, I don't believe unvaccinated employees should have mandatory weekly COVID testing. In Barnstable, Massachusetts, 74% of COVID-19 cases between July 3rd and 17th occurred in fully vaccinated persons. There are other people who have religious objections to vaccines, some of which are due to the use of unborn babies to produce the vaccine or in the testing of it. For these reasons and more, I believe the city of Racine should let their employees make their own choice. An arbitrary mandate demonstrates a lack of confidence in people's best basic capabilities to monitor their own health. When authorities pressure employees to make decisions against their personal convictions, they erode the morale of employees. When threatened with discipline or termination, people lose their desire to work for the good of the city and become concerned with personal survival. Is that what you want from city employees? Please allow them to make their own choice whether or not to be vaccinated. Encourage them to take care of themselves and seek help if they have concerns. This is the best way to empower city employees to carry out the role for which they were hired. Thank you.
Thank you. Amber, our next speaker, please.
Alder Tiff did have her hand up. I don't know if you wanted to speak to her first.
Sure. Is there a point of information? We don't generally do council business here, but who has their hand up? I'm sorry, I can't see the screen. Alder
Taft.
Taft?
Mhm.
Alder Taft, did you have a question or a point of information?
Sorry, I had a point of information, but I just got the information about our policy regarding public comment, so I think I'm okay. I was gonna move to limit it to city residents and employees, but I realize our policy has 30 minutes, so I guess I would want to say I'd like to try and stay to the 30-minute limit if our city residents have been exceeded. That's just my point of order.
Okay. We do have, I believe, 3 speakers left, Amber. Is that correct?
4.
4, which would put us at 12 minutes, which would put us about 10 minutes over our limit. Why don't we get through the next couple and we'll see where people are. Amber, if you could continue with the next speaker, please.
Of course. Our next speaker is Chelsea Locke, 5901 Adam Trail, Mount Pleasant.
It's actually Caledonia, but that's okay. And I'm going to have my husband speak on my family's behalf. Can you hear us?
We can, if your husband would like to enter his name into the record and can begin whenever he's ready.
Absolutely. We can go ahead and start right now if you can hear me. My name is Jason Locke.
Go right ahead, sir.
First thing that I would like to do is I would like to first say that I'm very disappointed in the fact that there's only 17 people that have showed up to this meeting to voice their opinions. I would then like to go ahead and thank Keith Garfalo, Tiffany, Melvin, Tammy, and Susan, as well as myself and my wife, for having the moral fortitude to stand up and speak their opinions. Of the 17 people, 2 of them have at least been a no-show. At the end of the day, the decisions that we make with our families are those for us to make. There is plenty of concrete evidence and proof that masks are not beneficiary to keeping us all safe. There is plenty of fact out there to show that the vaccines are harmful at alarming rates. The fact that the vaccine itself has in no way been tested in a long enough period of time to prove itself. The fact that the vaccine is using dead aborted fetuses in order to be created, that in alone and in and of itself will make myself and my family members a no-go. I would also like to mention the fact that of the entire population of the United States, 57% of people have at least received one vaccine, and I believe it's 49% of people that have received 2 vaccines. I think that those numbers speak for themselves. 50% of the population does not want to have a vaccine. 51% of the, or 50% of the population does not want to wear masks. At the end of the day, a large portion of that percentage was coerced in doing so. People that were made to get vaccines because of their jobs. So I think the numbers speak for themselves. There's over half of America that's saying no. Let us live our lives. Let us make the decisions for ourselves. I think that at the end of the day, I would love to conclude with the fact that the overwhelming majority of this evening was spent with people telling you that we don't want masks, that we don't want vaccines. Now, unfortunately, as number 9, I was not able to hear the rest of the 8 people. So I can't give you an exact percentage, but as we stand right now, about 35% of us do not stand for masks and do not stand for vaccines. At that point, I would also like to say that I'm very disappointed in the previous alderperson that decided to make a last-minute comment to withhold anybody that didn't live in the city of Racine from speaking their voice. I think that's absolutely atrocious and disgusting, and I hope that you could reconsider that, as we are all part of this community. Thank you, and I hope you all have a wonderful evening.
Thank you, sir. Amber, could you announce our next speaker?
Our next speaker is Jason Walker, 1822 Ellis Ave, Caledonia.
Hear me?
Yes, we can hear you, sir. Please begin.
All right, thank you. Members of the Common Council, another prediction of doom and gloom by an unelected official, Bowersox, who wants to be our savior. Every prediction by models, the WHO, the CDC, Dr. Fauci, and local health officials has been wrong. Shame on you for trying to ram this through in 4 days before people get wind of it. The government's had a carrot and stick approach to dealing with COVID. We can get back to normal after just 2 weeks, after masking for a little bit, after getting the shot. Lie after lie after lie. Looking at California and New York, where face coverings and lockdowns were the order of the day, we see being fully vaccinated and wearing a mask or face covering in public was clearly not the most effective way to protect each other and keep businesses open, as you say. Your proposed ordinance is suspect. Governor Evers has already been told by the Wisconsin Supreme Court he can't keep coming up with endless public health emergency orders for the same event, and neither can you. You speak of the indisputable authority of local governments to exercise their police power. Wrong again. You are forgetting Evers and Bowersox problems with the court telling them they had exceeded their authority. Bowersox doesn't truly understand being vaccinated is a personal choice or what personal choices and responsibilities are. If your lifestyle creates a comorbidity or you are unlucky enough to have a congenital issue, it is up to you to protect yourself. If vaccinations and masks worn and you choose to be vaccinated and masked, my health is none of your concern. I'm sorry, if vaccination and masks work and you choose to be vaccinated and masked, my health is none of your concern. Read the box of face masks you buy at the local Menards or Home Depot. They don't protect against viruses. Masks don't work and can be dangerous. The normal amount of carbon dioxide in the open is about 400 parts per million with a 2,000 parts per million limit for closed rooms. A German study found the measured readings in the dead space inside surgical and filtering face masks was about 14,000 parts per million, 7 times the limit. The highest reading of a young child was 25,000 parts per million, 12.5 times the limit. Such levels lead to hypercapnia, an excessive carbon dioxide buildup in the bloodstream caused by inadequate respiration, then causing your kidneys to work overtime to return the pH of your blood to normal levels. None of us need that day after day after day, especially children. You have provided 12 exemptions for people to not wear a mask, which effectively waters it down so much as to be unenforceable on the average citizen. However, threatening people with a fine and a business livelihood by revoking their license is reprehensible and ensures people will be refused service even if they have an exemption. There have been many recent large maskless gatherings with no large-scale negative effects at State Fair, the Bucks Finals, Lollapalooza, and Sturgis, to name a few. If there had been an issue with virus spread, you can guarantee it would have been all over the news. We're done. We've had an example after example of our politicians not following the very rules they set in place for our supposed protection. Bowersox thumbed their nose at the Wisconsin Supreme Court and continued to keep Racine schools closed. If politicians don't follow their own rules and Bowersox has no respect for the law.
Sir,
why should
please
anyone
conclude your
follow-
remarks, sir. Your time has expired.
It's my last sentence. If politicians don't follow their own rules and Bowersox has no respect for the law, why should anyone follow this ordinance you want to put in place? Thank you very much.
Thank you.
Our
Amber,
next-
how many?
Point of
how many-
order. Point of order. Then folks
Yep.
aren't supposed to directly attack elected officials as per the rules. So we need to call out on that when that happens.
Your point's well taken. Just as a reminder for the speakers, which the clerk read out, ad hominem attack
Or city staff.
on city staff or elected officials is not prohibited as part of the public comment. For future speakers, I'd ask you to confine your comments to the topics of the agenda itself. Thank you very much. Amber, how many speakers do we have remaining?
3.
Okay, there are 3 speakers remaining. That would give us 9 minutes. Without objection, I will ask the clerk to continue to hear from the final 3 folks who've asked to speak.
All right, our next speaker is Brian Weber, 6400 and Forest Lane, Mount Pleasant.
Hi, good evening. Thank you for your time this evening. My name is Brian Weber. I have 2 children who attend school in Racine. We live in Mount Pleasant. And I was just reading a report by the American Medical Association Journal, where they did a study, the JAMA report on carbon dioxide in children is 6 times greater after wearing a mask. And that's not after 8 hours. That's after 3 minutes. Now, common sense would tell us that carbon dioxide breathing in for long periods of time or even short periods of time is not good for us. Bacterial infections, many things can happen from this. I have worked and sold to the healthcare industry for many, many years, and know a lot of people in that industry. Many healthcare workers are against wearing the mask, and they're also against the vaccine. If these therapies or these things are effective, let them have that choice. They should have that free will. God has given us free will. They should have that choice to be able to do that, but don't force that on anybody. That is not right for that. There's a lot of fear with this Delta variant, yet they are not able to even test for it. How in the world, if something cannot be determined or tested for, do we even know that it's there? So I would like to close with just a quick scripture. This is God's word from Timothy, the book of Timothy. For God has not given us a spirit of fear, but of love, of power, and a sound mind. And I pray that people would use a sound mind, because when you're living in fear, you do not think rationally and you do not have a sound mind. Thank you.
Thank you, sir. Our next speaker, Amber.
Our next speaker is Jeremiah Anders, 5006 Alexander Court, Caledonia.
Amber, we're not able to hear the next speaker.
They are still muted. I'm trying to get them to unmute.
Okay.
1 second, please.
Hi, can you hear me now?
We can, sir. Please proceed with your comments.
All right, thank you. My name is Jeremy Anders, and I am in favor of the mask mandate. One thing to point out, the JAMA study that was just mentioned was actually retracted by the people that performed the study. And the fact is the American Academy of Pediatrics do recommend face masks to protect children over 2 from COVID. So I believe we are obligated to do many things for public safety, such as stopping at a stop sign, and wearing a mask should be no different to protect others. Masks are recommended by the CDC because we are in a high area of transmission and we need it to help protect each other, not just ourselves. The Delta variant is more contagious and causing breakthrough infections in our vaccinated population and even affecting more children. Additionally, some of our Racine schools are not requiring masks, and most students in those elementary and middle schools are ineligible for vaccination at this time. How is this protecting the children in our community? I know I wouldn't like to be in an enclosed building for 35 hours per week where a majority of those are unmasked and unvaccinated. I believe we should be doing everything we can to help alleviate the burden on our hospitals and healthcare workers. This pandemic has gone on for way too long and we need a reprieve, and masking will help. In closing, I believe it is prudent to be proactive and attempt to mitigate COVID transmission rather than having to react to infections that may lead to irreparable harm that could possibly have been prevented. Thank you all for your time.
Thank you, sir. Amber, I believe we're on to our final speaker then.
We are. Our final speaker is Joe Bradley, and once he's able to speak, I will have to ask him his address.
Great.
Check 1 2. Check
Joe,
1
can
2. You guys
state
there?
your address for us?
Sure. I don't think I should have to give that out, but I'm at 2906 Erie Street, right by the zoo. Ready to rock?
Sir, you have 3 minutes to begin your comments. You may start now.
Sure. I'm going to boil it down, make it real plain and Jane, simple for everybody. After 18 plus months of the COVID-19 biological, psychological attack on our nation, the great people of Racine will not tolerate any more tyranny from the local government. Even the once most uninformed residents now see clearly and have plenty of access to mountains of data revealing that masks and face coverings both do not stop transmission of pathogens and are in fact harmful in many ways to those who wear them. To create such an ordinance now would be to blatantly participate in this biological and psychological attack on our nation, as it furthers the harmful physical and psychological effects of the attack and worse. This would in fact deem you, the council, self-declared enemies of we the people, as you would be perpetuating and exacerbating this attack, aiding the attackers themselves, and essentially committing crimes against humanity. Not to mention this type of irregular warfare that the council is proposing is in multiple ways a clear violation of the US Constitution. To even consider such an ordinance reveals one of two things about this council. One, incompetency. Either the council is so misinformed and or brainwashed, perhaps due to the propaganda within this attack, that it actually believes what it's doing will protect the people of the city of Racine. Therefore, the council should be removed and replaced, as it is acting belligerently and not in the best interest of the people it represents. Or two, complicity. This council is in fact knowingly perpetuating and exacerbating this attack by acting in alignment with those who foisted this upon the great people of this nation and thus the city of Racine. And therefore the council should be removed and replaced accordingly, as this proposed ordinance would not be in the best interest of the people of the city of Racine. In closing, this council has the duty to represent we, the people of the city of Racine, and to ultimately look out for us, not to align itself with the very terrorists, either foreign or domestic, that have foisted this upon us, and literally join in their efforts. Do the great people of the city of Racine a favor and read a damn history book. Vote against this proposed nonsense. Oh, and I got 27 seconds left. So let me add to that. Can you hear me still? Let's hope so. 27 seconds left. You guys are, you know what you're doing. You're either with the people, you're either with the facts, the data, the figures, the truth, or you're against those things. And Dottie K. Bowersox, Corey, come on. This is a joke. At this point, it's a joke. Everybody knows it. You can stand up and show some leadership, or you can fold and join in the BS.
Thank you, sir, for your comments. Amber, I believe that concludes our public comments for the evening.
That does.
Okay. Moving on to the next item on the agenda, if we could, we will then take up the presentation from Dottie K. Bowersox on the state of COVID of Racine and our proposals this evening. Dottie K., are you available?
We had just a moment here. So thank you again for your time and effort this evening. I know this is a difficult decision. Anything with COVID has been difficult over the last 18, almost 19 months now. At the same time, during this time of heightened awareness due to the dominance of the COVID-19 Delta variant and low vaccination rates within the city of Racine, it is necessary for additional prevention measures to be implemented to protect the health of the public. Vaccinations are free and widely available. They have seen marginal increases since Delta's arrival within the US and in the state of Wisconsin. At the vaccination rate of 41.1%, additional precautions must be employed to slow the spread of this virus and ensure the health and welfare of everyone. The CDC recommends all individuals, fully vaccinated or not, wear a face mask in indoor public places in areas of the country that have substantial or high transmission of COVID. The city of Racine has been identified as an area of high transmission. An unfortunate milestone was reached this week where we had the 10,000th city resident tested positive for COVID over the last 18 months. I'm now going to turn the presentation over to Cody Pierce. Cody is the epidemiologist for the city of Racine. He will update you with the most current numbers that we're seeing again within the city.
Good evening, everybody. So just a quick update on our current situation, as Dedicate said. As of this afternoon, we have a total of 10,048 confirmed positive COVID cases in the City Health Department's jurisdiction. That is an increase of 206 over the past week. And just looking into that a little bit further, I can tell you that just over 20% of the cases in August have been in individuals 18 years or younger. So children account for just over a fifth of the total confirmed positives in our jurisdiction this month. Our case rate is currently 259 cases per 100,000 residents over a 7-day period. That puts us into the high community transmission level category per CDC standards. And as was mentioned, with substantial or high community transmission level, CDC recommendations are that anybody vaccinated or not wears a mask in indoor public locations. Most new cases that we are seeing continue to be among unvaccinated individuals, and the highest rate of infections currently in the 25 to 34-year-old age group, followed by 35 to 44-year-olds and 18 to 24-year-olds. I can also tell you that currently we are at 126 individuals who have died from COVID in our jurisdiction. 3 of those deaths are just within the last 2 weeks, and the youngest death in our jurisdiction was an individual 24 years old. So cases by date of diagnosis, you can see the history of the pandemic dating back to mid-March of last year to present day. The various spikes and surges that we've seen, including the large one in the middle of the graph over the fall and winter period last year. And you can see comparing from March 18th of this year to present, comparing it to last year, you can see that we've seen kind of similar spikes, and it looks like that we may be kind of reaching our fall winter spike a little bit early here compared to when we did last year. So moving on, looking at community transmission again, any county shaded in red here is seeing high community transmission. That's 100 cases or more per 100,000 residents over the course of a week. Racine County is one of 67 counties in the state, I believe, currently that are within the high category. 4 other counties currently in the substantial category, and 1 county in moderate level right now. And again, CDC recommendations are any counties or locations with high or substantial community transmission should have indoor masking. Looking nationwide, this is current picture, a lot of, again, high and substantial community transmission across the country. There's one other way here. See our community transmission level over the course of the pandemic. But for the bulk of the pandemic, we have been either within the high, the red shaded area, or the substantial, this lighter orange color. Those 2 categories. Looking at vaccination currently, state of Wisconsin overall, 54.7% of individuals have received at least 1 dose of the COVID-19 vaccines. 51.4% of individuals have completed their chosen vaccine series. The city of Racine on its own is sitting slightly lower than that. 45% of individuals have gotten at least one dose and 41.1% have completed their chosen series. And nationwide, as well as locally, lagging vaccination rates have allowed greater spread and have really allowed the Delta variant to become the predominant variant in our country. However, vaccination rates measured by the average number of new daily first doses has improved slightly since we reached our lowest period in mid-July. So over the last month and a half, our rates have climbed slightly. Speaking specifically about the Delta variants, you can see that ever since May, when it was first starting to be detected in Wisconsin, it has by far become the predominant variant in the state, increasing from 2% in May to more than 95% of sequence samples in August of this year. That the Delta variant is at least twice as contagious as the original strain, and vaccinated individuals, while they can spread the Delta variant, still have greater protection or receive protection from the vaccine from hospitalization, severe illness, and death. Looking at hospitalizations in healthcare in Wisconsin and in the area, statewide hospital beds are sitting at about 88.5% occupied. ICU beds even higher than that at 92.1% in use. COVID-related hospitalizations have been trending upward ever since late July. In southeastern Wisconsin, the numbers are even higher. 92.8% of hospital beds are currently in use in southeastern region of Wisconsin, and 94% of ICU beds are currently in use. Vaccination and masking together in public places are key. They prevent healthcare systems from being overrun and allow individuals needing care for other conditions and other injuries to receive that care as well. Vaccination and masking also help to slow further spread and will help to get us back to normal.
Oh, thank you, Cody. Why mask? Universal masking in public can significantly reduce the spread of COVID. No methods are perfect for preventing COVID spread. Masks, along with other public health interventions, are effective. We have finite resources for healthcare, first responders, which would include our fire and police, and public health professionals. The entire population under the age of 12 does not yet have access to the vaccine. And then I wanted to review the ordinance. Pick out some points here that I think that were brought up and will be of interest. So under the definitions, the face coverings means a uniform multi-layer piece of cloth, fabric, or other material that securely covers a person's nose and mouth and remains affixed in place without the use of one's hands. Now with this, the ordinance itself is very similar to the ordinance that expired on June 30th. And with that, we have taken out the outdoors criteria. So the public space means any indoor space that is open to the public. Does not include private residence, private residential property, private offices, or workspaces that are not open to customers or to public visitors. Again, the use of face coverings in any indoor setting, riding on public transportation, taxi, private car service, or ride-sharing vehicle. Now, within the framework of the ordinance, we do have exceptions. Exceptions are for children aged 4 years or younger, individuals who have upper respiratory chronic conditions, persons who fall into the CDC category for prevention guidance who should not wear face coverings due to a medical condition, mental health condition, disability, or otherwise covered under the Americans with Disability Act. Persons who are obtaining a service involving the nose, mouth, or face, in which temporary removal of face covering is necessary to perform the service. Persons who are seated at public places, but not limited to school cafeterias, restaurants, or other establishments where food or beverage services, whether eating or drinking. If it poses a risk to their work as determined by local, state, and federal. If persons whose religious beliefs prevent them from wearing a face covering in private individual offices when no other individuals are there, while giving religious, political, media, artistic, cultural, musical, theatrical, or other public presentations before an audience. So again, that's a list of the exemptions. We do have the penalties, which haven't been changed. Prior to the expiration of June 30th of the previous face mask ordinance, we had no one that we had given citations out to. Now, we talked to a lot of individuals with the assistance of the police department. We educated a lot of individuals. We provided masks to a lot of individuals, but there were no citations. We're a complaint-based agency, and our first recourse in interaction is that of interacting with education. And then finally, as far as the expiration date, at any time that the community transmission for COVID-19 for the city of Racine is at a moderate or lower category for 3 consecutive weeks, the repeal or continuation of this ordinance shall be considered by the common council. So again, as Cody mentioned, and as the slide indicated, we're in the high category. Below that is substantially high, and below that is the moderate. Now, we've been there before. And I'm confident that we can do it again. But again, we need to take all mitigation efforts and activities that we can to slow down the spread of the Delta variant. So that concludes our presentation on this item. So we're delighted to take any questions.
Any questions from Dottie K. Bowersox or for Dottie K. Bowersox on this item before we move on to the presentation on the other item on the agenda this evening? Any questions from, we can do stop the screen share. So there we go. Thank you. Alder Peterson.
Yes, thank you for the presentation, Bowersox. Right now, what are we in percentage with the county? What percentage of infection rate compared to the county? During the last mask mandate, we maintained about a 40% percentage of the infections. Are we at about that now, or are we higher than that?
Dottie K, did you hear that?
I think is Alder Pearson requesting a comparison between the county and city numbers as far as the number of positives?
I believe so, yes.
Correct. Oh, during the last year, we were always 40%, or 40% of the population, and we were 40% of the infection rates. Could you give me how we're?
So Alder Peterson, I don't know if you're at a place where you can pull over while you're asking your question. It's very difficult to hear you. You've got a signal. It might be because you're in transit. I think we got the gist of your question. I'm going to ask Dottie K to begin to try to answer it. And if you're at a place where you can pull over, we can do any follow-ups that you'd like. Dottie K?
Thank you.
Hello. Point of order. Point of order.
Alder Peterson, you're breaking up. We're having a hard time hearing you. What I'd like to do is have Dottie K try to answer your question. And again, if you're at a place where you can pull over and get a more reliable signal, I'm happy to let you ask any additional questions you might have. Dottie K?
Sure. So Alder Peterson, this may help to answer your question a bit. Currently, well, as of last week, Wednesday, I don't have current this week data yet, but as of last week, Wednesday, the city's case rate that I mentioned earlier was about 35% higher than that of the rest of the county. So I don't know if that helps with your numbers. Question.
Okay, so that's the most recent comparison of infection rate compared to the county. Alder Peterson, if you'd like to try again to ask an additional question, or if that wasn't your question, and hopefully you're at a place with a better signal, can you try again?
Actually, right now my car is breaking down. We're leaving the highway. I'm going to be leaving the meeting.
Oh, well, be safe, Alder Peterson. Be safe. Alder Tate II.
Thank you, Mr. Mayor. I'm gonna text Alder Peterson and see if he can share his question with me and relieve them too. So if I have more than, have to come back a few more times, hopefully council members will understand it's to speak on behalf of members who are having difficulty. One of my questions was as it relates to this potential ordinances, we know about the increased ability to be transmitted of the Delta variant. And I know we're talking about reintroducing a mask ordinance. What are our plans for, providing, materials that better protect our residents with this more transmissible variant? Such as, ordering en masse N95 masks for our residents, because it seems to a degree insufficient for us to say you got to wear a mask, but also, whatever you have might not be the best option in terms of actually reducing transmission. People have cloth masks, surgical masks. I've read in places that the best thing to do is if you're going to wear a surgical mask, then it will be paired with a cloth mask outside of it, and to not do that with N95s and things of that nature. So, I feel like we need to be giving more to our residents other than just saying, put something on your face that's multi-layered, and being more specific and saying, here's the tools that are best going to protect yourself and others and maintain our ability to navigate and participate in the local businesses without adding any additional risk or concern as we're going about our lives in the safest way possible.
Dottie K?
Yes, thank you, Alder Tate. So within the framework of the ordinance, we talk about face coverings include but limited to medical masks and multi-layered.
If you can. Try and make it to Howell if you can.
Alder Pearson? Yeah.
Alder Peterson, you're coming in and out. If you could mute yourself, sir, and if you need any help, please text or call one of us offline, please. I'm sorry, Dottie K, please continue.
Okay, that's all right, thank you. So again, medical masks and multi-layer cloth masks, so they securely cover the person's nose and mouth. So N95s are masks that need to be fitted to an individual. There's various sizes, as well as various brands. Individuals that have mustache, goatees, beards cannot be fitted for them. That's why when the use of facial masks, again, we ask, yeah, I know, Alder Tate, and we ask for individuals for medical masks and or multi-layered. We've talked in here that garments such as bandana scarves or gaiters don't make the cut because they can't be secure on the face. At the same point, the multi-layer is significant. So if you get a mask that's single layer, you can wear 2 masks.
Okay. My second question was, and this kind of goes perhaps more to Cody, but I'll let the chair kind of direct it as best seen. I recently read that perhaps our focus on case rate, because the Delta variant is so transmissible, is perhaps the wrong metric for us to be evaluating, making particular recommendations upon. And more so should be focused on the hospitalization rate as well as death rate as opposed to case rate, because at some point, either we're all going to be vaccinated or all infected. And the case rate itself will become kind of a non-factor, although it will be indicative of how much it's spreading throughout the community. So I guess I'm curious as to how our evaluations of where we are 18 months later, given the change in the actual virus and its functioning within our community, how we're examining the data from a different lens, understanding that it's operating differently, so we kind of have to evaluate differently in terms of its impact and how we respond.
Dottie K, can you talk about how the increased transmissibility, if that is a word, of Delta has made us pivot as we try to deal with it? For Dottie K, to you or to Cody, or whichever of the two of you feel is more appropriate to answer.
Sure. Yeah, Cody's got this.
Sure. So great question, Alder Tate. It's a good point. We kind of focus still on the case rate because those are the criteria that the CDC has set forth for determining their masking guidelines and recommendations at this point. The other things you mentioned, hospitalizations and deaths, are things that we do keep an eye on regularly. I mentioned some of those in my recap of our kind of current standing. So those are things that we are looking at, and I think you have a great point of looking more at those in a virus that you have that is as transmissible as the Delta variant is. Maybe looking at pure case numbers is not always the best option. So that's why we continue to look at those other things as well.
Okay, thank you.
Thank you. Alder Perez.
Thank you, Your Honor. I just wanted to clarify, this is an amendment to the chapter, but this particular one doesn't have an enforcement arm. Who will be giving tickets, citations, closing down businesses? Can she clarify that for us?
I'll direct your attorney or your question to the city attorney. Attorney Letney, can you answer Alder Perez's question on the enforcement component of the ordinance?
Alderman, like before, this is something that the police department could issue citations for violations. And also like before, there is a provision with regard to license revocation for businesses if the businesses fail to comply with the ordinance. None of those things happened the last time around, but those provisions do exist again, just like they were before.
All right, thank you.
Thank you. Alder Pete.
Thank you, Mr. Mayor, and thank Dottie and the other person for the great presentation. But my question is, do we have any hard data supporting that wearing the mask reduce the infection hospitalization rate or ICU rate from both the Delta and the regular COVID-19? Thank you.
Dottie K or Cody, could either of you answer that question, please?
Good question, Alder Pete. So I can't, I guess, speak specifically to the Delta variant compared to the regular variant in terms of mask use, but I don't have reason to suspect that the Delta variant would behave any differently with masks than the regular, any other strain of COVID. So as we kind of talked about before, there have been a number of studies that have been peer-reviewed and published in reputable journals that talk about how masks are effective. So I'll just recap a couple of those for you. A study from February of this year that was published in the Journal of the American Medical Association reviewed data from 10 other studies that concluded that mask wearing substantially reduces spread. They said that wearing a cloth mask can reduce transmission of exhaled droplets from infected wearers into the air by as much as 50 to 70%. And masks were also shown to help prevent uninfected wearers from inhaling large respiratory droplets. Overall, the authors found that masks' main benefit was source control, meaning preventing an infected person from spreading their illness to others, but it did also provide some benefits in protecting the wearer from contracting illness as well. Other studies from other journals and other universities have estimated that tens of thousands or hundreds of thousands of cases of COVID could have been prevented from mask mandates being issued in states and counties across the country. One study found that within 1 to 5 days after a mandate was issued, just 1 to 5 days after, case rates dropped nearly 1 percentage points and dropped further, with more time. So there's a lot of literature out there in many reputable journals that do show that masks are effective when worn correctly and appropriate mask types are being used.
Yeah. Alder Pete, I also have statements from Advocate Aurora and Ascension about the masks and about the need for vaccination.
Alder Pete, you're muted if you had a follow-up question.
Thanks. Sorry about that. Thank you, Mayor. I appreciate the information. One other question: is there any studies been done or data collected on the use of young people under 12 being wearing the mask? Do we have data that supports that young people reduce their transmission or infection rate?
Cody, do you want to take that one on, or Dottie K, either one of you?
Yeah, do you want to just repeat it?
I don't have specific tissue.
You're a pediatric.
Right. Yeah, so I don't, the study summaries that I have in front of me, Alder, don't specifically relate to children. They're just general population studies, but the American Association of Pediatrics, as mentioned earlier, does recommend and support masking in schools as one of many ways to protect kids in school from COVID.
Okay, moving on, Alder Mi'kmaq.
Thank you, Your Honor. This is kind of a little bit of a follow-up to Alder Pete's question. And just first, I just am seeking some clarification because I do not remember. I apologize. What was the date that we lifted the mask mandate?
Oh, it was a glorious day in June, but I cannot recall which specifically. Dottie K or Attorney Latton, either of you know specifically when we sunset the last ordinance?
Yes, Mr. Mayor, Alderman, it expired of its own accord on June 30th.
That's right. Okay, thank you. So then the question follow up with that to Dottie K or Cody, what have we seen then? Obviously, we've seen a spike over the last month. Do we have any evidence that that is a correlation to the end or the expiration of the mask mandate? Is that something that you all have considered as you watched cases rise? And do we have any evidence of that?
Dottie K, if you could talk a little bit about the correlation around mask wearing and infection rates, but if you could also just mention the R0 of Delta versus previous strains, because that might play into this as well.
Yeah, and excellent question, Alder Mi'kmaq. Thank you very much. No, we don't have any data for the correlation of the end of the previous mask or the sunsetting of the previous mask ordinance and the climb in cases or the spike in cases that we're seeing right now. So we don't have the capacity to do that, and so we do not have that information for you. At the same time, as we looked and as Cody had mentioned in one of the previous slides, we have seen the increase of the Delta variant. So taking over from being from 2% to 97% of what we're seeing, and knowing that it's highly contagious and much more so than the original variant of COVID.
Okay, thank you, Alder Mi'kmaq. Alder Rouse, welcome back, by the way.
Hi, thanks everybody. Thanks for having this meeting and having that presentation, Dottie K and team. A few things I wanted to address going forward. One, we've heard a lot of disinformation. We've heard a lot of conspiracies that have been debunked, and I think it's important to make mention of some of those so that when we're making these policy decisions, no one has something like that lingering in the back of their mind. So Dottie, I don't know if this is best for you. If not, I have my own information. Could you speak a little bit about how masks are not dangerous to wear long-term? That, for example, wearing a mask long-term is not more dangerous than COVID itself.
Dottie K, can you address some of the...
And that should cover things like carbon dioxide intake and bacteria growth and stuff like that. Go for it.
Yeah, Dottie K, if you could cover that, I'll just remind everyone in terms of public comments, we don't edit for content. It's 3 minutes of open mic unless they're violating our rules. We do let the public address us as they wish. And so there's no sort of, stopping those comments to do a fact check. So Dottie K, if you could give some context about some of the carbon dioxide comments and the mask ordinance work, that would be helpful.
All right, thank you, Mayor, and thank you, Alder. Yes, I know the comment about the carbon dioxide, but nonetheless, JAMA research. It was not a research; it was a letter, and it was retracted. But I don't have any other information that's been provided. As Cody had mentioned previously, we have information about overall mask usage and about the effectiveness, which, we saw that in influenza last year, for example, that we were all below baseline for the transmission of influenza, and that has been attributed to the use of the mask because the vaccination rates were about the same. But that would be the bulk of information.
Thank you. Alder Coe?
I don't have a question. I have a comment to make, but I'll let everybody exhaust your questions first.
Okay, I just remind you, Alder Coe, when we're done with Dottie K's presentation, we will then get to the items themselves, and that might be the place to comment on the policy position itself. It's really a question opportunity for people who
I know.
have.
That's why I said I'll wait.
Okay. Attorney Latney, did you have a comment?
Yes, Your Honor, thank you. I erred when I answered Alder Meekma's question. Actually, the mask ordinance was set to expire June 30th, but Mayor Mason suspended enforcement on May 14th, and then the council actually repealed it on May 18th. So the council repealed it early.
Okay, thank you for that clarification. Any other questions? Alder Cole, did you have a question now, or is your hand up just from before? Any other questions then from for Dottie K. Bowersox on this topic? If not, we will move on to the next item for discussion, where we've asked Dottie K. to present us with some information regarding the testing policy around city employees. Dottie K., whenever you're ready.
Okay, thank you, Mayor. Okay, there we go. So thank you, Mayor, again, and thank you all alders. So we're talking now about the employee COVID-19 testing policy. Again, we've talked about the Delta variant. The original strain of COVID infected about 2 other people for every person that was positive. The Delta variant affects about 5 other people for every person that's positive. So 5 and 5 and 5 and 5. So again, much more contagious. Mitigation strategy designed to limit the spread of COVID virus in the city workforce, attempting to reduce exposures from unvaccinated individuals who may be pre-symptomatic or asymptomatic. Existing mitigation measures that we're currently using: social distancing, face mask use, and vaccination. Next one, Cody. To ensure the continuation of city services, we want to prevent and reduce the transmission among employees to preserve the finite city resources, maintain healthy business operations and work environment. And at this point, at least 9 of 14 city departments have had COVID positive employees in 2021. Employers have an obligation to manage potential exposures, and we do that in many ways in many departments. And it's important to differentiate between COVID-19 and other viral infections such as influenza. So again, we have policies for individuals to be, I'll repeat again, we have policies for individuals to be out with COVID and testing and such, but testing allows us to understand the difference between the two. Again, I wanted just to briefly review the information that you've been provided. Very basic. All City of Racine employees shall be tested for COVID-19 each week. The exception is that for those individuals that are fully vaccinated, they have several ways to demonstrate their proof of vaccination to Human Resources: a CDC vaccination card, immunization registry record from the Wisconsin Immunization, a record from their healthcare provider, military immunization record. So again, basically, number 2, the City of Racine employees who are not fully vaccinated would get tested every single week. Now, we've had some questions along the lines about this, just to clarify, the City County Clinic does not do testing for COVID for city employees, but they facilitate it, and it's facilitated through Ascension All Saints, and there is no $4 co-payment. All the Walgreens stores here in the City of Racine do testing. Because of the number of people that are increasing and requesting amount of testing, it's now scheduled online, so individuals can go online, pick their date, pick their time. And again, there is no charge for that. And then the testing at Festival Hall concluded on Monday of this week. We have requested that testing be extended until the month of December, and we've extended it to Mondays as well as Thursdays. And again, there's no charge for that interaction. On the Racine Coronavirus website, we do have a link directly to the Department of Health Services that's maintained on a regular basis that itemizes not only in the city of Racine, but in the county and surrounding areas of all the testing sites that are available. Let's see, and that concludes the presentation for this. It's short and sweet. It's pretty basic. At the same point, we're delighted to entertain any questions.
Are there any questions for Dottie K. Bowersox on the proposed employee testing policy for COVID? Any questions? Alder West.
Thank you, Mr. Mayor. I do have a couple questions. The first question would be, who's going to pay for that testing? Will it be the employee or the city? And the second question would be, where can the employees take this weekly test?
All right, I'll ask Daddy K. Bowersox to repeat the last piece, and I'll try to summarize it. Daddy K, please expand or revise if I get this wrong, but our city employees can facilitate an appointment to get one through the city county clinic with no cost or copay to them. They can go to any Walgreens and get it done for free. They can go to our website, racinecoronavirus.org, and link to the Wisconsin DHS page that will show you all the areas in your surrounding area that have testing locations. And Festival Hall has been available on Mondays. The hope is that will soon be available Mondays and Thursdays, again, at no cost to employees to do that test. Daddy K, did I mischaracterize any of that or forget any of the options that are available for free to employees to get tested?
Yeah, real close, Mayor, just a couple of things. So with the City County Clinic, it's not at the clinic itself, but it'll be at the Extension Office facility. Excuse me.
Thank you.
All right, that concludes. Sorry.
Alder West, thank you for asking that question again, though. I thought it was a good question to get clarified, and we've had a lot of people ask that question in the last couple of days. So clearly it's on people's minds. So thank you for asking that question. Alder Jones.
Thank you, Your Honor. My question was, since we can still catch the Delta variants after we've been vaccinated, I wrote my question down. Will there be any requirements for the people that have had the vaccine to get tested? Because those people could be asymptomatic and have the virus, but they've been vaccinated.
Daddy K, can you talk to the testing of the already vaccinated piece of that? I don't believe that's part of this proposal, but if you could.
Yeah, thank you, Mayor, and thank you, Alder. Yes, you are correct, Mayor. That is not part of this. So for those individuals, this is for the individuals that are already vaccinated are exempt from being tested on a weekly basis.
There's certainly nothing in here that would discourage people who are already vaccinated from getting tested if they've been exposed or if they're concerned that they have symptoms or just for their own edification. Okay.
Yeah, and we do ask that for employees, obviously we're masked up. We're maintaining social distance. We're not gathering in groups. I think we've got 3 people is the most that can gather at this point within city employees. And we're still doing the contact tracing and notification. So if an employee does have contact with someone who's close, we get in contact with them, as well as if someone is symptomatic, we're asking them to get tested. So that is part of the policy, not this one, but it's part of what we do on our daily basis.
Thank you. Alder Jones, did that answer your question?
Yes, it does.
Thank you.
Thank you.
Alder Tate II.
Thank you. I have a couple questions from Alder Peterson, who's still, observing. So thankfully, first one is kind of a follow-up to Alder Jones's question. People who have been vaccinated are also getting COVID. So what's the rationale to not testing all? I know you kind of spoke to that, but I want to ask it as Alder Peterson presented.
And Daddy K, very similar question. I don't know if there's any nuance that you would give to your answer, given the way that Alder Peterson presented it.
Yeah, and we're asking, again, individuals that are vaccinated, that are symptomatic and or close contact with someone who is a confirmed positive to get tested. We would reach out to them and have conversation with them and ask them to comply with that. And then they would also monitor their symptoms if they had any.
Right. Alder Tate II, did you or Alder Peterson have other questions?
Might be harder for him to provide a follow-up, but there was a second question relating to does this have to be bargained for or addressed in collective bargaining for units that still have that ability?
I will ask the city administrator to attempt to answer that question since it's out of Dottie K's bailiwick.
I would actually defer to the city attorney on collective bargaining issues.
Okay, then to Attorney Letney. I don't see him on the screen right
He's
now.
here. He's here.
Where is he?
Where is
Sorry,
he?
so many boxes.
It's the Brady Bunch.
There he is. Sorry, you're on my second page, Scott. If you could try to answer that,
No
please go
worries,
ahead.
Mayor. Thank you. Well, I think it'd be hard to argue it's not a condition of employment. I have already met with the representatives from the 4 police and fire unions, so I could let them know what was coming. I have another meeting with them on Thursday. I think we'll have to bargain the impact of this. I don't want to go into too much more depth because I don't want to bargain publicly at this moment, but I think it is something we need to talk to the unions about, and each of us expressed that opinion when we talked on Monday.
So, although we're not discussing adoption, I'll actually follow up on that for myself. Right now, it is just a Q&A portion. But if that is something that does need to potentially addressed as to bargaining, then is it prudent for us to be passing this tonight if there's still bargaining to be addressed?
Well, what is required to be bargained is the impact or effect of the policy, not necessarily the policy itself. So work rules can be imposed, and if they have an effect on somebody or effect on work rules, effect on bargaining unit, then that issue needs to be addressed, not necessarily the work rule itself.
All right, now I'm going to pivot to my own questions, not Alder Peterson's. So as it relates to employees being tested, would this be something that would be required to do off the clock, or is it something that they would be given time as they're working to do on the clock?
I'll refer that question to the city administrator.
Yeah, so the intention of the policy is, again, it's a testing policy, right? We want to require testing for the safety of our employees and the people who visit us in a public manner. So we believe it's a reasonable condition of employment to require testing because if they can show their vaccination, then they are not required to do it. So we do not want to set up a precedent where someone can say, oh, well, I don't want to be vaccinated, so therefore I won't get tested, and therefore I can take an hour or 2 every week and go get tested. So we are developing the policy that will be distributed to departments, that it will be on your own time to get tested. If that is your choice, which is a requirement, if this policy is adopted tonight, that it will be on their own time and they will have to prove that testing on a weekly basis. However, if they choose, as we have always supported, and our supervisors and departments have supported, if they want to go get vaccinated, they are allowed to go on work time.
Okay. All right, and my last question is there any kind of risk associated with frequent nasal swabs as it occurs with the COVID testing?
I will ask Dottie K if there's any risk to the frequency for nasal swabbing testing that she's aware of.
No, there is not, that I'm aware of.
All right, thank you. That's all I have.
Okay. Alder Coe.
Yes, I'd like to know, are we going to take this, are we going to vote this both together, or can we split these? Because I have a comment to make on both of them.
They're listed separately on the agenda, Alder Coe.
Okay, I just want to make sure that it's done separately. Thank you. And like I said, well, I'll make my comments when we're ready.
Okay, great. Alder Santiago.
Yes, thank you, Your Honor. Not to beat a dead horse, but I would like to take it back to Alder Jones and Alder Peterson's question. I feel like I didn't hear a real answer there. Being that vaccinated people can and are contagious and can spread the virus, what was the specific rationale that you used? What was the scientific data that you used to make that decision where one class of people, that have the vaccine do not get tested and unvaccinated people do get tested? Can you please elaborate on that And how did you come to that decision? Thank you.
Yeah, Alder Santiago, it's a good question. I'll let Daddy K clarify, but just to clarify, there are conditions when we do ask vaccinated individuals to get tested. The difference about this proposed policy is it requires all unvaccinated people who haven't opted out to do it weekly. Daddy K, can you give a little more clarification on that if I've mischaracterized any of that?
No, Mayor, that's accurate, and thank you, Alder, for the question. So with this, yes, there have been breakthrough cases across the country. We've had breakthrough cases here in the city of Racine, but again, they happen infrequently. So with the testing policy, it is for those individuals that are unvaccinated. And if we take a look at the hospitalizations and if we take a look at the death rates across the country, we're seeing that the majority of them are with unvaccinated individuals. So when we take a look at, we talked about that we're in the high category. We talked like that we're about a month ahead as far as the number of positives in comparison with last year. We've got school opening up, we've got the holidays, and we're going to be more indoors. We want to make sure that those individuals that are unvaccinated, that they are COVID free. But again, the breakthrough cases do happen, but they're infrequent and rare.
Thank you. Alder Taft.
Thank you. Sorry, that was my question. That was basically my question, because I think there's some misinformation going around about breakthrough cases, and there's a perception out there that since people can get breakthrough cases, that therefore vaccination is not a useful strategy potentially. But I guess I wanted to have you all reiterate the rates of breakthrough cases and the rarity of that. So if you can elaborate that on a little bit, that would be helpful. But you did sort of get at the answer to that question.
Daddy K Bowersox or Cody, any more clarification you want to add on that point?
Yeah, we've seen 86 cases of breakthrough cases of COVID since May of this year. So again, in comparison with the number of positives that we're seeing, again, it's an infrequent.
Okay. Thank you very much. City Administrator Vornholt, you had your hand up. Did you have a comment or clarification to make?
I do. I just want to not lose, and Dottie K is giving you the science and the rationale, but I also want to remind you that we have a responsibility to create a safe workplace for all our workers and all who enter our buildings. And what we have seen in the science, which Dottie K has told you, is that vaccinated people, for the majority, is the best course forward. And that's why we're proposing this policy, is to protect our employees and to protect the public who interacts with our employees. And we're basing it on the best strategy to create that safe working environment. I don't want to lose sight, and that's not Dottie K's responsibility to tell you as council and the mayor to provide that safe working place, but that's why this is before you tonight, based on what we think are the best strategies to do that. And I think you can see that so many employers are going down this route, right? And again, I want to emphasize, this is a testing requirement. This is not a vaccine requirement. If you just look north to our neighbors, they're simply going in Milwaukee with you get vaccinated or you face implications. Quite frankly, that would have been administratively a lot easier for us to handle, but we didn't want to go that route. We still want to encourage our employees to get vaccinated. That's why we chose this strategy.
Thank you, Administrator Vornholt. Alder Perez.
Thank you, Your Honor. This has brought up a bunch of questions. Following up with what the administrator just said and what Alder President Tate said a little while ago, I have several questions. For example, why not then test all employees as opposed to just the ones that are not vaccinated? And if it's all right with you, I'll ask all my questions and then they can be answered. Is that all right, Mayor?
Yeah, if you could ask, as long within reason in terms of the number of them. But yes, go ahead and fire off your questions.
Yeah, because I've talked to many city employees who don't have a problem with the testing, but they want everybody to be tested. because we've said now several times in both presentations that people that have been vaccinated can actually have and pass the variant on to other people. And I'm wondering if that's something that we have considered. Several of the questions that I had have already been asked by Alder Tate and answered, but I have a couple more following up with that. If you do test positive, is your time off covered under workman's comp? And what time, employee time, will you have to use for quarantine? Is it sick time? Because thinking of the police and fire unions at the beginning of the year, they were not issued the 80 hours added to their time for their sick time. And at what point do you come back to work if you've tested negative, because the infection tastes a positive? Infection can last from 3 to 6 months from some of the studies that have been done. And does an antibody test exclude non-vaccinated members from testing? Those are some of the kind of the bigger ones. And I'm thinking, if you fail to comply with this, another penalty that we have listed on this ordinance is termination. And we're having a hard enough time getting professionals to join our crew, thinking mostly of police and fire who are exposed all the time to the community. And I'm wondering if we're just being extreme with an effort to try to protect our own community internally, when we could maybe do something different. If you can have someone respond to those, I'd appreciate that.
I'll ask Dottie K to answer the public health related ones, and then I'll ask the city administrator to address the policy related questions that are there.
Thank you, Mayor. So again, Alder Perez, thank you for the questions. Again, the breakthrough cases that we've seen of COVID are rare. As we've mentioned, we've been at 86 cases since the month of May. So it happens infrequently. And the other issue is, as we see more disease prevalence within the framework of the community, we've got resources that through the healthcare systems, through the pharmacies, that we need to be considerate of. So we've only got so many test kits and so many this and that we'll get from the state. If you recall, when this first started, we had a very difficult time getting test kits and supplies and such. The supply chain is much, much better, but we want to ensure the viability of that as well. Bobby, let's talk about those. Bobby Fergus is the Community Health Director. She will talk to you about the timelines on when individuals turn positive, when they can come back to work.
Good evening,
Bobby?
everyone. Yes. So if an employee were to test positive, they would be, if they were asymptomatic, they would be out of work from 10 days from the date that test was taken. If they remained asymptomatic, then they would be able to return back to work. If they were symptomatic, they would be out of work from the time their onset of symptoms started for 10 days. So it does vary. Those employees that were positive would not need to be retested for 90 days unless they were symptomatic. If they remained asymptomatic, they would not need to be tested on a weekly basis, because there is a chance that they could continue to test positive.
And just to be clear, Bobby, that is currently our policy, correct?
Correct.
Okay. To the city administrator or city attorney, anything there on a policy basis that either of you want to address? Paul?
Yeah, so Alder Perez, I think your question is how if they were having to quarantine or to not be on work, what would they be allowed to do and on their own time? They certainly will. Their sick leave would be available to them. Their vacation would be made available to them. I'll defer to the city attorney on the additional hours that were afforded to non-representative employees. That now hasn't been exhausted, by the way. So let's make that clear. I think there was a lot of emails going around that I saw that somehow the federal government had extended that. That is not the case. They did make allowances. They did ask you if you wanted to do it. City of Racine did not adopt any extension of those benefits because the vaccine had become so readily available, which is right back to the same point that we're going back to. So for non-represented, if they were to test positive They would have to follow then our current protocol, which is to quarantine and to stay away from work for a while. They would be allowed to use any time available, whether it's sick leave or vacation, to accommodate that, as if they had the flu or had to stay home with a sick child. Those same things would be available to them. It would be different for collective bargaining. And I know that Attorney Letney has already advised you that that would be, quote unquote, the impact that may have to be bargained.
Alder Jones.
Thank you, Your Honor. I guess this is kind of piggybacking off of Alder Perez. Number 3 of the resolution. My question is, you've got an exemplary employee who's an outstanding, but if they fail to get tested for the virus, they can be terminated. I wanted to know, basically, I believe Attorney Letney touched on it before. Will that be enforceable to terminate them for not getting vaccinated, although they are great employees, worked for maybe 10 or 15 years for the city, but because they failed to get tested, they're terminated?
I will let either the city attorney or the city administrator just speak to the work rules that exist for this proposed rule or any rule in terms of non-compliance. I just want to make it clear, I don't think the policy is proposing that the first response of a non-test is immediate termination. If the city
30
administrator
days, I think it says.
could lay that out in terms of the progressive nature of that, that would be helpful. Paul?
Thank you.
Yeah, and I'll let Attorney Letney talk about the progression of discipline, but that is what we had laid out as a typical progression of discipline of any work rule that an employee wouldn't comply with. So, there would be a verbal discipline, there could be a written discipline, there could be a suspension without pay. But yes, ultimately, if they continue to violate a workplace policy that this body adopted, it could be a cause for termination.
Attorney Letney, anything else you'd like to add to that?
Yeah, thank you, Mr. Mayor. Ma'am, all work rules could theoretically result, if somebody violates them, in being terminated. I mean, there's a general desire, and the way the work rules are applied is that there's progressive discipline, but one might imagine such a violation that somebody jumps ahead through all those different steps in one time and there's an immediate termination. Now, that's not what's proposed here, but there is no requirement that each step go through. So the way this policy is written is that anybody that refuses to test or refuses to provide proof of testing would be suspended until they provide such testing. And yes, if they go for 30 days, then they could be terminated. So frankly, if you think about it, that would be 30 times violating this policy every single day they refuse or fail to provide a test. So it wouldn't be the first time. I mean, but that's the way it's written.
Thank you. Mr. Powell, did you have something you wanted to add?
Just a point of clarity on that. It is proof of negative test or vaccination, right?
Yes.
So the way to get out of it, if you don't want to have to show the proof of test, is you can also get vaccinated.
Yeah, it's an important clarification on the opt-out provision.
We should also add that Attorney Letney and Director Bowersox also put in the standard exemptions for vaccination. And, so there are exemptions for those who, for whatever, legal or religious reasons, can say that they don't want to be vaccinated and or tested, can make that case and be exempted.
Thank you.
Alder Pete. I'm sorry, Alder Pete, you had your hand up earlier. I don't see it up now. My apologies. Did you have a question, sir?
Thank you, Mayor. Excuse me. Alderman Perez in particular covered most of my questions.
Okay, thank you very much. Any other questions for Dottie K? Just as a reminder, and Alder Coe has been gracious enough to remind us of this too. This is Dottie K's presentation on these issues. We will then move into the later parts of the agenda where we will consider the items and debate them, and so people can make their comments or have debate on it at that time. Any other questions for Dottie K, specifically given her presentation on this? I'm just looking through both screens here. I don't see any additional questions. So with that, we'll ask Dottie K to please stick around in case there are additional questions that come up during the debate. But thank you and your department very much for heroic work that you had to do in the last year and a half to try to mitigate COVID in our community as best as possible. With that, we will move on to the next item on the agenda. And just let me formally bring up the number on it here. I will actually, because I don't have it right in front of me right now, ask the clerk to read the next item on the agenda for consideration.
Item 0689-21, direct referral communication from Mayor Mason, President Tate II, Alder Lemke, and Alder Taft requesting the Common Council adopt ordinance 0013-21, indoor face coverings. Recommendation of Mayor Mason on August 31st, 2021, that ordinance 001321, indoor face coverings be adopted.
This time I would entertain a motion to approve said proposed ordinance.
Move to approve.
So motion to approve from Alder Taft. Is there a second?
Second.
Second by Alder Lemke, I believe. Discussion on the item. Alder Taft, you made the motion. Would you like to speak to your motion?
Yes, thank you. I guess in reflecting on all of the things that I've read and I've heard over many weeks, including recently, it's a little bit disheartening how much misinformation about masking is out there. And I just want to reiterate that we know that the CDC, this is their entire job, is to evaluate the data, among other organizations like the American Academy of Pediatric Association and all of these many health and science related organizations that support the idea that the gold standard for ending this pandemic is vaccination, followed by masking in public spaces. It is safe, it is low risk, it is absolutely, the data supports that this slows the spread of the virus. And so I think we have an obligation in our community to protect the vulnerable folks in our community, to protect populations that are vulnerable, that can't get vaccinated, like kids under 12, that this needs to be something that we do to protect our community, this mask mandate. We know that about 70% of folks want to know what the best practices are and are looking for guidance and leadership, which we are providing if we pass this mask mandate. So I think we will save lives by passing a mask mandate. And I have further questions. I'm sorry, the ordinance on the masking. This isn't a mandate. It's an ordinance that really is all it is doing is providing guidance to wear a mask when you're indoors in public spaces. So if folks don't want to wear masks, nobody's saying they have to go in public spaces. It's a choice. Choices have consequences. The idea that choices then involve the lack of consequences is not something that we should be promoting. So I think I'm fully supportive of a mask mandate as, sort of the bare minimum thing we can do to protect our vulnerable populations and everyone else, really. So I'll let other people talk.
Thank you, Alder Taft. Alder Perez.
Thank you, Your Honor. I don't necessarily disagree with Dr. Taft. I understand what she's saying. However, here's where my concern comes in. We continue in appearance to erode the community's rights based on a bigger picture, like the Delta variant, COVID, which apparently everyone will get eventually somewhere along the line. We're looking at mandating masks in public and private places with the result of revoking licenses and closing businesses, and it's just too extreme. You know, Dr. talked about guidance and leadership, and I get that. That's very important. But our guidance could also be that, according to the science that we're currently looking into, this is the best practice we can do. But to create it in such a way that continues to bear another cog in what appears to be the erosion of people's rights overall just seems to be just hard. Having had COVID, I understand the implications of not getting a vaccine, being sick, almost dying. I totally get that. I also understand that I have a responsibility to represent the people in my district, and all those, by the way, who have contacted me personally in my district don't think that this is the way to go for our community. I had one person that was not in my district contact me and say it was. And so I see us opening ourselves up to another lawsuit if we pass this ordinance about the mask. I see more businesses closing. People are tired of what appear to be arbitrary requirements for them based on good science or maybe pseudoscience. Apparently, like in every case, and that's why we have attorneys, there's a pro and con to every issue. And that's where we find ourselves in most issues. And the person or the group that has a better argument most of the time wins. But we've moved on to what we've done in the past, which has brought lawsuits. We're talking about having to defend lawsuits again if we pass this. And we have to weigh, I think, our responsibility to the community. I think we can show leadership by saying that we strongly recommend that we, according to the science that we're looking at, this is a way to do it. But to go ahead and fine people and to revoke their business licenses, I get it. We have to wear seatbelts and take all those precautions, but this is different. This is getting a vaccine into your body. There's religious objections. This is wearing a mask where people can't see in public. It's just going beyond, I think, what our scope should be. I'd strongly reject this. I know the arguments have been made on both sides, but I strongly reject this based on the fact that we've gone too far. And as we can give a really strongly worded recommendation, but to go ahead and say, we're going to revoke your license, we're going to give you a ticket if you don't wear a mask. I think that's going too far for us as a community. Thank you.
Thank you, Alder Perez. Alder Mi'kmaq.
I apologize, Your Honor. There were quite a few people that put their hands up before me, so I don't want to.
Sorry, I'm just
no, I know it's sorry.
Just taking them on the
Rouse
squares that we have
for a while.
Sure, if you want to defer to Alder Rouse, I'm happy to call on Alder Rouse next.
Thank you, Honor.
Thank you, and thank you, Alder Mi'kmaq. I want us to look at this in the scope as to what other municipalities are and have been doing, because that's often a way that we make these decisions. And in our case, a mask requirement is such a basic minimum level of protection. Other cities and entire states are looking at vaccine requirements. They're well beyond mask requirements. So for us to hesitate over a mask requirement, I think we're really behind the ball there. As far as the perception of taking away rights, that's a great example of what our purpose as aldermen should be, is to be able to educate those people that might be misinformed, that think that this is a violation of rights. We never want to give the perception that we're taking away, but we also don't want to act on perceptions. We want to act on the science and the legality and reality of our Constitution, to which we swore an oath to. Something like this is constitutionally protected. So for us to waver in our decision-making based on a fear of violating the Constitution, it's not good enough. It's not good enough for us to make that argument when we have a legal team, when we have the ability to call and get advice when we need it. And that being said, I want to make sure that I mention out there, yes, I'm laying down. Yes, I'm in a chair. I am here several days after being released from the hospital. I'm here because this is an important decision to be made for our city and I didn't want to miss it. I'm not taking this decision lightly. This is the most I could do in the given surgery situation. So with that said, I'll relinquish my time back to those who have questions.
Thank you, Alder Rouse, and thank you for your commitment to being here in the midst of your recovery. Alder Coe, you had a statement you wanted to make?
Yes, and don't mind me, I was up writing this at 3 o'clock in the morning. So over the last week, I have had a lot to think about. I visited about a dozen businesses and asked what they thought about the mask mandate. The places I visited share the following with me. They are doing everything they can to keep their businesses safe. They are wiping off counters, table, and doors a number of times during the day. When customers come in with masks on, they ask a customer, would you like me to put a mask on? Some say yes and some say no, but they appreciate being asked. This is a decision I do not take lightly. I have people attacking me no matter which way I vote. I have my own family members attacking me saying that they have no respect for me if I don't stand up for American rights and tell me I don't have the right to be in government office. People that have been very sick with COVID asked for the mandate. I had COVID and it's not a joke. I am thankful I did not get any sicker than I was. The business community has been going through this for 18 months. I believe they do everything they can to keep their businesses safe. What has been lost here is civility, no respect for each other. There are people who want no rules at all. That is wrong. If a business puts a sign on their door that says mask required, some people ignore it. That's not right. They should honor that business's request. But these people argue and say their rights are being attacked. The store owner has the right to do what he thinks is best for his customers, and people should honor that. There is no way to really enforce a mandate. People still will try to go into places because they feel the rules don't pertain to them. Then who gets in trouble, the business or the patron? If the mandate is not countywide, it will hurt the businesses in the city, and that is not fair. They have been through enough over the last 18 months. I will be voting no on this item, but I hope people will honor businesses that say you have to wear a mask to enter. If not, they should be the ones to get in trouble. I, for one, will be wearing a mask, no problem. We are elected to do what we feel is right. I make my decisions based on what I feel is best for the community. I make up my own mind and will always vote based on that. The hateful emails need to stop. Just because I vote for something that people don't believe in doesn't make me wrong or them right. People need to start working together or this will never end. I am not getting hateful emails from people who want the mask mandate. They are only sharing their concerns. What does that tell you? What about their rights? Think about it. Thank you.
Alder Mi'kmaq.
Apologize, man. I hate to be a line jumper. So if you don't mind, I'll continue to defer to Pete and Lemke, who also both had their hands up for me. I know I'm being
Sure.
weird, but thanks.
Sure. Alder Pete.
Yes, thank you, Mayor. Coming after Alder Coe, Alder Rouse, I may have to repeat some of the sentiments that they've already expressed, but I'm still somewhat new to the council, and I've been around in various decision-making capacities for more decades than I will admit publicly. But this is one of the most tumultuous decisions or issues that I've had to deal with. With that said, I take it very seriously, and I think about the oath that I had to take to uphold the law, whether it would be at the federal, state, or local level. And I take that very seriously. I leave my personal convictions or morality out of it, and I simply look at the responsibility that I am charged with. And I am not an attorney, but I would like to refer to a case going back to 1905, the Supreme Court in the defense of Jacobson versus the state of Massachusetts. This was a outbreak in endemic with smallpox. Back then, 1905, the United States Supreme Court ruled, and I'll paraphrase here, that the people who were charged with the responsibility of protecting the health, safety, and welfare of their constituents had a duty that goes beyond the shadows of and also, I'm sorry, the health departments and scientists had a moral responsibility that goes beyond that of other people who add contributions. I don't want to offend anybody because, and I'm digressing here for a purpose, because I do want to say that I respect all of the emails that I received. And I would also say that, excuse me, close to 50% of those letters or emails were against mask mandates. And a lot of the majority of them were from my district. But as I say, the majority of them were against the mask mandate, maybe 49-51. I'm not going to split hairs, but the point is, I understand that with this issue, like many other issues on a local level, we are split. So I have to make my decision based on my moral compass and the rule of law. With that said, this same issue came up last year, went to the Supreme Court with several cases, one in Arizona and one in the state of California. Chief Justice Roberts ruled, and I'm going to paraphrase, I can send you the information if you want this specific case, but the bottom line is that the elected officials, as well as the health department and the science community, have an obligation to protect the citizens. And so taking everything else aside, that's the way I have to look at this. What is in the best interest of the citizens in general, from the health and public safety. And secondly, I'm reminded of part of the law of jurisprudence that our country is based on. We have a saying that we would rather let an innocent man go free as opposed to convicting a guilty person. So I'm not sure if I said that clearly for everyone, but the bottom line, I will err on err on the side of caution as opposed not to. And I'll leave you with this. When I was looking at my decision, I had to remember, like everyone under the sound of my voice, if one person becomes a casualty because of my decision or lack of decision, I'm the person that has to look at myself in the mirror for the rest of my life, wondering if that choice may have made a difference in that life. It only takes one. I thank you.
Thank you, Alder Pete. Alder Lemke.
Thank you, Mr. Mayor. There have been a lot of good comments and perspectives from everyone today. So I just wanted to start by saying that I know we are all long since tired of COVID. It's an understatement that there have been 18 months of stresses for people at work, losing work, with their health, schooling their kids, socially distanced or virtually and now in person, and distancing ourselves from loved ones hasn't been easy on anyone. And, you know, for some folks, I realize it's been a lot harder if their jobs or whatnot have been impacted. I also want to say that I think, you know, I've been getting letters, calls, we've heard from people today, and I think that everyone is, you know, doing their best to live their daily lives, raise their children, you know, go to work. And I think, you know, as we've seen this like divisive rhetoric nationally. What I've seen actually in Racine is a lot of efforts for people to gather around one another and, you know, pull together for supporting healthcare workers, for the restaurant owners, and, you know, people just caring for their neighbors one-on-one to make it through all of this. And, you know, as one of my esteemed colleagues said, just, you know, all pulling together. And I think nationally, the debate has turned into like an us-them issue. But in the end, I think that all of the sides are just trying to balance the risks that we hear about and also taking care of our loved ones the best way we know how. So I'm in favor of the mask mandate. I think, you know, there are people in our community who are vulnerable, whether it's they have an illness and they can't get vaccinated. And I think, you know, just doing our best, you know, to kind of take care of our neighbor is why I support this measure. I will say that, you know, I hear people's concerns and they're not, you know, they're valid, they're not invalid, right? And I think one of the things that I want to emphasize is, you know, we're trying to do the best with all that we know about the Delta variant to, you know, protect vulnerable members of our community, but also remembering that we do have off-ramps and in exemptions that I hope will address people's concerns. You know, I've heard worries from, you know, like business owners like restaurants, and I think, you know, it's important that we keep restaurants going. I've been trying to frequent them as much as possible myself, and really appreciate those folks in our community. So there are exemptions for when people are eating. I know people have expressed concerns, you know, specifically if someone has a disability or health concern in that way. And I think we also have, you know, exemptions for that. So I want to really, I think what we're trying to do is strike a balance between, you know, helping to protect the vulnerable members in our community, but also realizing that there are, you know, there are exceptions. And, you know, in the last case, we did end the mask mandate early, just or the, you know, masking ordinance early, and then even got rid of the ordinance entirely after we stopped enforcing it early. We both stopped enforcing it and got rid of it early because we were no longer in that sort of like high transmission category. So I just want to underscore to people that we're trying to do our best to balance the fact that there are people who, you know, that can't get vaccinated and that are really at risk, while still understanding that there are, you know, businesses that need to be run and people who, you know, might have disabilities or other health issues that we have to account for. So I hope that that is kind of a balance of providing a level of protection for our community, but also at the same time realizing that we have to respect people's individuality and individual circumstances in cases where that's necessary.
Thank you, Alder Lemke. Alder Migwa.
All right, thank you, Your Honor. I appreciate you humoring my request earlier. Well, thank you, everybody. It's been great to hear from you all and be able to discuss this. I don't know if it's great to be discussing this again, but nonetheless, we are discussing this again. So, you know, it's been an unfortunate turn of events. It's led us here. I know a lot of emotions are high. I know that a lot is at stake. You know, and I want to be honest. I want to hopefully lend a different perspective to this and be able to speak on some of the things that have actually caused me concern with this. And, you know, I believe that I represent a significant portion of the community and the fact that I'm kind of middle of the road on this. And I know there's a strong voice on the one side and a strong voice on the other side, but a lot of times those two groups are actually in the minority and most people just reside somewhere in the middle. And honestly, that's kind of where I find myself in all of this as well. You know, on the one hand, we have a strong case being made for reintroducing a mask mandate based on plenty of scientific fact. We've heard it from our people. There's plenty of articles out there that are certainly in support of this. But I also understand that there's a lot of angst over this from people that don't feel wearing a mask is necessary. I understand some of their concerns, but I do feel that we as a body have a responsibility to protect public health and human life where we are able. On the other side of the coin, I find myself in conflict with this action for a few specific reasons, and that's really what I want to talk a little bit about at this point. First of all, and very much like what Alder Coe had said, I'm keenly aware of the significant impact that this may have on local business. We, as the city of Racine, are at an unfortunate disadvantage that our municipality or that our municipal neighbors are not as willing to take this sort of action, which puts us in a situation where we have to be different. And by being different, being different is not always good for business, and especially in our community. Unlike other communities, in the city of Racine, you can literally just cross the street and you're in that other municipality that doesn't have an ordinance. Other cities are considering this, but they have a much wider breadth of area within which to operate and within which businesses to support each other. Where in the city of Racine, you don't have to go far to leave the mask mandate and pick a different business. And, I think that is certainly something which is something that needs to be considered. This is hard on businesses because a lot of patrons who wish to rail against a decision like this will willingly avoid city business, cross that street, and go somewhere else. That weighs heavy on me because I know that businesses have been impacted and have been struggling. It's especially costly when we're talking about specialty businesses, like bowling alleys, for example. I feel that as we consider this ordinance, we need to be mindful of the impact this may have on our local businesses. Now, I do want to be clear. I'm not opposed to a mask ordinance. I do think we can see the need through the data presented. I am, however, concerned about the impact that this has on the businesses and the psyche of those who have been proactive up until now and trying to do the right thing and make the right decisions. I know that I'm going to work on committing to continuing to find ways to help support and find solutions for local businesses if this mask mandate is presented. I think that's important, and I think that is incumbent upon us as a body to try and find ways to help them navigate this wherever possible. But I also want to speak directly to the residents of our community. Our local businesses need you. I know it's not ideal to have to wear a mask, but don't let that stop you from supporting our local shops and businesses, restaurants and establishments. They need you. If you're frustrated with the ordinance, don't take it out on them. It's not their fault that they are following a mask mandate that we have put in place for the reasons that we believe it needs to be there. Go bowl at Castle Lanes, go shop downtown. Don't use this as a reason to stop supporting local. Use it as a reason to do it more. If you hear someone out there saying they're not going to go because there's a mask mandate, you be the first one to go to that business and support it instead. That's a big deal. That's how we grow and thrive as a community. Let's take the high road. Let's rise above all those that want to be negative and angry, and don't give up on our community because we have to wear a mask. Wear a mask because you refuse to give up on our community. I want to just say last couple of comments to my colleagues. And I hope you'll reflect on what I said about finding ways to support our businesses and be thoughtful as we move forward if this mandate passes, finding opportunities to lift them up, work towards a sustainable and healthy community. And finally, I just want to reiterate that in some part, this is a vaccination issue. If more people were vaccinated, actions like what we are considering tonight wouldn't be as necessary. So please go out and get vaccinated. Tell your friends. There is now an FDA approved vaccine. I know a lot of people were waiting for that. So now is the time. We can beat this, but we have to do it together. And we need more people in the community to do that and to help our community get through this and ultimately thrive. So thank you everybody for hearing my words. I hope I was able to provide some insight. And thank you again to all my colleagues for your time and energy this evening.
Thank you, Alder Miedema, for your thoughtful words. We do still have Alder Pete and Alder Coe with their hands up, although you've spoken already. If you're done, please lower your hands, albeit virtually. Alder Peterson, you've not yet had the opportunity to speak on this. I wanted to give you the opportunity to do so now.
Thank you. I was in Dane County today, bringing my kid up to college, and Dane County has a mask mandate. We went out to eat. I got no problem putting on my mask going into a restaurant. I got no problem going into my mask, putting in a business, anybody that asks it. I guess the problem I have with our mask mandate is
that it's not countywide. Because we are such an intertwined community, I question the efficacy of it and the effectiveness of it, being that people move throughout our community, Caledonia, Mount Pleasant, One Point, Elmwood, we're very intertwined. So I question whether or not how effective it'll be. I get it. I'm not an anti-mask person. That as well as it's gonna make it much more difficult on the entertainment, especially the entertainment restaurants, bars, for them to get, they're not playing on an even playing field. People will go west. You got stubborn people that won't wear a mask. Like I said, I got no problem wearing one, but I will most likely vote against this just because, like I said, I question how effective it is having just the city of Racine doing this. If it was the entire county, I would look at it differently. Like I said, I was contacted by a couple small business owners, and virtually every call I got was against the mandate. Some of those you take with a grain of salt, but the business owners that I talked to or contacted me, expressed their displeasure and the angst of how it's going to affect them financially and how difficult the last year and a half was. I don't foresee any PPE money coming out to help these people out anymore. So for those reasons, I'll be voting against. Thank you.
Thank you, Alder Peterson. Alder Caprillion.
Thank you, Mayor Mason. COVID-19 has definitely brought many challenges to the city of Racine, its government, its people, its businesses. The city has many angles that we have to consider when making these decisions like this and for the process. I wear many hats. I'm a mother, I run a household. It's easy for me to dictate how things are going to be for myself and how I'm going to move forward for my family, but it's not as simple for government. Again, we have many angles and public health being one of them. I would like to really personally thank the health department. You are doing exactly what you should be doing for us. Looking at the public health and putting out messages about what you feel is best. Again, it really hurts me to hear individuals personally attacking those who are putting a lot of weight on their shoulders, and they're wearing the responsibility to successfully and responsibly look at the public health of our city. So thank you, Public Health Department, and those who spoke tonight for us. Alders, I'm sure I'm not the only one who has received calls, messages, text messages, and through various means. We all sat and heard public comment this evening. I would just like to put out there that each and every one's standpoint is right. It's right for themselves. And as we can see, there is no consensus one way or the other when we look at individuals' personal way that they move forward through this. So I respect Mayor Mason, Alder Tate II, Lemke, and Taft for bringing forward the ordinance 001321 for indoor face coverings, as they propose a way to address this and hopefully protect the public health of our community. But I would like to see a more innovative approach to this current situation. Please know this is not disrespect to the efforts of this communication. This has been going on, as they've been saying, for 18 months. And we had a mask mandate that ended June 30th, as what was mentioned earlier. And I feel like that we, with this negative impact of COVID and how our community, how we are responding to it is, I don't want to say it's antiquated, but we're not moving forward through this time of crisis. We need to look at how we function in long-term crisis and our ability to operate more effectively in that crisis. Are we keeping balance with all of our focus and our governmental responsibilities? I think maybe it was Alder Meekma who mentioned about finding ways and solutions with the businesses if this does go forward. I think we need to be doing that now. We know that having a mask definitely is something that helps through this time, but we need to offer a little bit more. It shut down our businesses and their ability to be able to sustain themselves. And that is one piece of our responsibility. And we aren't much of a city if we don't have business. And so even keeping in mind the public health of our residents and of our employees, but I think we need to be a little more innovative in our solution. And, you know, I'm willing to bring up some ideas, but I don't believe we're adapting well in this time of crisis. I think we need to adapt better so we can be a more effective government. So those are my comments. Thank you for allowing me to share.
Thank you, Alder Caprillion. Alder Tate II.
I know how to unmute myself. Thank you, Mr. Chair. Obviously, I'm a sponsor of this, so obviously I'm in support of it. I had a friend tell me or ask me earlier today, when's the city gonna shut things down? Because this friend also pays attention to the news reports. They pay attention to the trends of the data. They pay attention since the beginning of how this pandemic has operated, gone through communities and affected lives. And my response was obviously, hopefully never. You know, we want to get ahead of things before they become things that we can't manage. I believe last year, you know, we kind of perhaps hesitated before we introduced a mask ordinance. We hesitated with certain interventions. And I think a lot of us did because you're like, is this the course we really want to take? Is this the route we really want to go? Were any of us elected to making, you know, dictations to our citizens? No, none of us were. But that is the role of government and representatives to deal with the situations where we may have to say, this is what we have to do as a community. This is what we have to do as a state, city, country in order to be safe, in order to protect one another, in order to survive this crisis. So when I think about us doing this now, you know, certainly we see things trending in the undesirable direction, but there are still 2 tiers higher of category that we could be in, and we're not there yet. And if there's a time to introduce an intervention that can stem that tide, now's the time to do it. Instead of, let's say, in October, when we're already in the severe, the very high category, and you know, we're suddenly discussing like, oh my gosh, you know, what do we have to do about capacity limits? Because that's not something I want to be approaching. That's not something I want to be discussing. Again, I think, you know, an intervention right now of requiring masks to be worn indoors actually sustains business operations as opposed to diminishing them if things go in the wrong direction as we enter into the cold and flu season, where people will be restricted indoors and more susceptible to transmission. That's partially why we see things happening in the South, in the southern states as they are, because it's so hot that people are spending a lot of time indoors with air conditioning, and thus in shared spaces where transmission is almost unavoidable. And if we can do that now and acknowledge that that's the reality that occurs, because the data is there, we know how things trend. It tends to get here after because it starts in other places in the country. And we can either get ahead of the trend that's already coming this way, or we can wait for it and have to deal with it in a worse scenario. I don't want to catastrophize. I can't use words today. I don't want to think catastrophically about these things, but that is our job. As the elected representatives of our city, we need to think about 1, crisis management, 2, public safety, and 3, how do we sustain and thrive a community? We don't want to always be in a crisis mode. Unfortunately, that's what we got. We didn't ask to be in a crisis mode. Unfortunately, that's what we got, and that's what we're dealing with. So I think as we have experts in our health department, as we have experts in other departments, whether it's public safety, public works, or whatever, they're the folks that we pay to provide recommendations for us to deal with situations, and for us to effectively debate whether those interventions are what we go with. Our debate isn't the data. There actually really isn't a both sides to the data. There are folks who are reading things and not understanding what research means, and then there are folks who do in making the recommendations. These are not equal evaluations, and we shouldn't treat them as such. everyone can have a personal opinion. Not everybody is an expert, and your individual opinion does not rise to the level of expertise of others. We just have to accept that. We as Americans love to have our opinions. That's great. We have rights to our opinions, but our opinions are not the same when it comes to the experiences and the expertise that each of us have gained either through our lives or our study. And we shouldn't treat them as such, particularly when we're having to make decisions about serious situations. You want to have an opinion about who's the best basketball player, go for it. But if you want to have an opinion about how do you deal with a respiratory virus that is transmitting at a, whatever the R rate is, maybe the guy who just started reading Facebook isn't the one to follow and listen. Maybe the YouTuber who you've never heard of and won't produce their degree isn't the one who you're supposed to listen to. Perhaps the public health advisors and the folks who've done this work for years and study and evaluation are the ones to at least put more stock in their opinions. Because that's, I believe one of our employees and fellow county supervisors speaks to, data literacy. And, there's a lot of things that we're not necessarily all literate on around the country and around our community. And some folks are more literate. For public health, we have folks who are more literate than the rest of us. And we ought to put some stock in those opinions and those evaluations and those determinations. I think our general process, since this has begun, has been to follow the expertise of those who we hired to be our experts. I know there's a lot of consternation when we repealed the original mask ordinance because some of us were uncertain. That was the guidance we were getting, but we were uncertain if it was, the right time to do that based on various reasons. However, as a majority, we repealed it, despite those reservations, because that was the expert guidance we were receiving. Right now, we're receiving expert guidance that says the best thing to do right now to stem transmission and manage this virus in our community is to employ a citywide mask ordinance for indoor usage with obvious exceptions. We've gone this course this far. I feel it would be irrational, illogical, and logically inconsistent for us to suddenly deviate and say, economics, now we're not going to follow the expertise of folks who've been following the whole time, who've helped us maintain a relatively manageable and reasonable level of transmission, even though there are some things that are unavoidable. And I think when we talk about, innovation, to a degree, I feel like that's a bit of an insult to the folks who are providing the recommendation, as though, there's something else out there that they don't know of, that they're not telling us or they're not thinking of. And I don't think it's necessarily on us to figure out how to be innovative in managing a pandemic. Like, we have experts for that to provide those recommendations. So, as I mentioned, I'm obviously in support of this. I think, if we're going to continue on this path, there's certainly some necessary pieces that need to change, whether that's, acknowledging some realities that maybe we don't want to acknowledge or are hard to acknowledge 18 months into this, like the reality is COVID-19 in its various forms will probably be with us in perpetuity. That's a reality. We can get vaccinated, it'll go through people, they'll get their natural immunity, but it's not going away. I believe I read at some point the 1919 flu is the base of what the current seasonal flu is every year. These things don't necessarily go away, but they do get to a point where they're manageable and they're not wiping out swaths of the population. We're not there yet. And we need to do everything we can to protect each other and the population until this particular virus gets to a place where our species can manage it and kind of to acceptable degrees, as opposed to kind of throwing hands up now and saying, well, we can't do these sorts of things. And yes, it stinks that it's just us in Racine County who are willing to do the things that, ultimately protect our community and each other. And hopefully, we can continue to work with the county and other municipalities to, bring them along. But I think this is an opportunity for us to be leaders. Just because everybody else isn't doing it or is unwilling to do it doesn't mean that we're not supposed to, because we have the ability to. We have the information that says that we should, and we'll find out in a moment if we have the political will to do what is difficult, but potentially what is necessary. And we've made these difficult decisions time and time again. I am quite tired of it. But, you know, when I asked to represent the 3rd district, when I asked to be the leader of this body, I knew with the understanding that there are going to be unpleasant things that come our way, and we're going to have to make hard decisions. And if at some point somebody says, no more John Tate, we're done with him, you know, because he keeps making these choices, I will leave this space knowing that I did everything that I thought was necessary and appropriate to protect my citizens, my constituents, my friends, neighbors, loved ones, and everybody who is under the charge of the government of the city of Racine. So with that, you know, I'll yield the floor to others who want to speak to this, but hopefully, you know, everyone's kind of said their piece and feels that they're comfortable with what their decision is going to be. We can make our choice, move forward with confidence that our city knows that we've thought hard, thought long, and wrestled with the uncomfortable choices that are before us, but we're doing what we think will best serve the health and wellness of our community in the near term as well as the long term. So I'd love to have more citizens here next year than we do right now. And I'd love to have not made a decision that prevents that from occurring in that case. So thank you.
Thank you, Alder Tate II. Alder Caprillion, did you want to speak again?
No, thanks. I apologize. I put my hand down.
Okay, thank you. Alder Taft.
Thank you. I just wanted to say I really appreciate everybody's comments, and I'll keep my remarks brief. I just want to, you know, I'm very sympathetic to, I just want to start out by saying, you know, we are not doing anything to, you know, shut things down or whatever. Okay. This is a mask ordinance that requires people use a face covering to go into public buildings. You know, restaurants are exempt, all these kind of things. I just want to put it out there that the city of Racine was on the front lines of providing resources to businesses. I think we were like the first city that was providing our own, resources to businesses that were affected by COVID. There are a lot of state and federal programs, state programs through REDIC and RCDC, I think if I said the alphabet soup, that businesses can appeal to. So businesses are not without help. But really what this comes down to is, as Alder Tate said much more eloquently than I, following the science, following the experts, and using the data to keep our community safe. And that has got to be our priority. And it's not our fault COVID is here, but we have a responsibility to use the best advice of the experts to keep our community safe. And so I urge my colleagues to lead on this and do the right thing and keep our community safe by putting into effect this particular ordinance. Thank you.
Thank you, Alder Taft. I have no one left in the queue to speak on this item. So with that, I will go to the clerk. Amber, who's the first vote for tonight?
Alder Pete.
So Alder Pete is the first vote for the night. When the just to remind everyone what the item is before us, and just to read the item one more time. We've had a good conversation here, but just want to remind everybody precisely what we're voting on. It's item 0689-21, communication from myself, President Tate II, Alder Lemke, Alder Taft, requesting the Common Council adopt ordinance 0013-21 regarding indoor face coverings. When the clerk calls your name, please vote as you wish.
Alder Pete.
I approve. Aye.
Alder Coe.
No.
Alder Jones. Alder Jones.
My apologies. Yes, forgot to unmute.
Thank you. Alder Tate II.
Aye.
Alder Santiago.
No.
Alder Caprillion.
No.
Alder Peterson.
No.
Alder Horton.
No.
Alder West.
Aye.
Alder Rouse.
Aye.
Alder Perez. Alder Perez,
He's shaking his head no.
oh, I
You're,
couldn't.
you're unmuted now.
Alder Perez, can you try verbalizing one more time?
Oh,
Thumbs up, thumbs down.
I see him. I see him now. Sorry. All right, so no for Alder Perez. Alder Taft,
Aye.
Alder Mi'kmaq,
Aye.
Alder Lemke.
Aye.
8 ayes. 1, 2, 3, 4, 5, 6 noes.
The motion carries. Thank you, everyone, for a very thoughtful debate. I do have a copy of the ordinance in front of me now, which I will sign into law and get to the clerk immediately to put it in place upon adjournment here today. Moving on next to the next item that we have before us is item 0690-21, communication from myself requesting the Common Council adopt a policy requiring that City of Racine employees comply with certain COVID-19 testing and public health protections. At this time, I would entertain a motion to approve or to adopt item 0690-21.
Motion
Move to approve. Oh, second.
Is a motion made by Alder Lemke on this item, and it was seconded by Alder Taft. Alder Lemke, would you like to speak to the motion?
Yes, so I'm just in support of, testing requirements. I think, we want to, when we interact with the public, we want to make sure that we are not spreading something ourselves. And so I think testing is a good strategy to do that. I made inquiries about, I think that they were already underscored, but I made inquiries about, I didn't want, some undue burden of finances or something to fall upon our employees. And it was made clear to me that there were options for, like testing through our clinics, and that would be supportive, that people wouldn't have a copay. And that was important to me, that, we make things accessible so it's not causing burden on people who want to go that, to be tested. And I just think, again, we have a responsibility that if we're going out and, some of the positions that we have, sure, are not public facing, but there are people, there are a lot of people in city government that are serving the community and the public face to face. And I just think, making sure that folks are tested is the best way to ensure that folks are safe. And so I am just in support of testing to keep, our staff and the folks that we see in the community on a day-to-day basis safe. So I support testing.
Thank you. Alder Coe?
Yeah. I'm just making a comment. I do not have a problem with weekly testing for employees that have not been vaccinated. Here are my reasons why. I have not been vaccinated. I have never had a flu shot or any other yearly shots. I believe the science is sound. I just never wanted them. That being said, I have a decision to make. I have a new granddaughter on the way in the next few days. My daughter told me if I want to see her, I need to be vaccinated. Before anyone gets bent out of shape, I value my daughter's decisions. She is doing what she feels is right for her family, and I will respect her decision. I did not share this for anyone to be outraged by her decision. My point being, I would get tested every week if it would help me see my granddaughter without getting this shot. We need to be more tolerant of each other. Let's stop the hate. I hear that the city and the union are supposed to get together on Thursday. I say we defer this item until that happens. If it passes tonight, there is no reason for the city to meet with these employees. Let's see if we can work together and come up with an agreement. I think coming to an agreement, working together will go a long way to improving morale and coming together. So at this time, I would make a motion to defer this item until after this meeting with the city.
So motion to defer the item. Is there a second to defer this item?
Second,
Second,
Who made the second? Alder Peterson? Okay. There's a motion on the table to defer this item. Is there any discussion on the motion to defer? Alder Tate the second. Did you want to speak to the motion on deferral or the main motion itself?
Main motion.
Okay. Alder Lemke.
Yeah, I'm just curious too. So I think it would be helpful also if we kind of know why we would want to clarify that, because I'm in support of voting for it tonight, because I did have some questions that came up to me about how it would be implemented, but I think that they were addressed. So I don't know if anyone can clarify.
I'll ask the city administrator or the city attorney to address the policy versus implementation. Paul or Scott, if either of you want to weigh in there and offer any comment to Alder Lemke's question.
I will always defer to Attorney Letney on collective bargaining issues. I do know that, as he said earlier tonight, that they had a discussion about this policy potentially being implemented. And again, it is not the policy, and I will let Attorney Letney clarify this, that is the issue. It is the impact that it may have on the collective bargaining unit and the workplace rules that would be applied to them and the impact that they might have a right to bargain. So I would argue tonight that the policy is perfect to implement, and that we meet with them after the fact and bargain the impact of it. And I would defer to Attorney Letney to clarify anything that I have said incorrectly.
No, of course, the Common Council can pass this tonight or defer it. It's up to the council. But again, as the city administrator said, it's the impact of the policy that we bargain, not the policy itself.
Alder Caprillion?
Thank you. I just want some clarification on the motion to defer for timing. Is there an idea for the maker of the motion when we would like to see this come forward again?
Alder Coe?
Yeah, well, I mean, I talked to a couple of people today from the union, and I don't think they have a problem testing per se, but there was some things they said they needed worked out, and I think we should honor that. If they meet Thursday, if we pass this tonight and they meet Thursday, there's really no reason for them to meet probably. I mean, I think it would go a long way to bringing people together instead of just shoving this down their throat. I think we need to start doing some things by working together. That's my reason being. I mean, and I have a question for the city attorney or the mayor. If this passes, if they come to an agreement, does it have to come back to us?
A good procedural question for Mr. Letney. Just as a reminder, Alder Coe, not everybody is covered by a collective bargaining agreement.
I understand, I understand it.
But I'll let the city attorney offer some context to your question.
If I understand your question, you're asking if there are some details in the policy that might be modified based upon a discussion with the union, would it still have to come back to the council? This is the council's policy if it chooses to implement it. So only the council can decide to act. Because this would alter for non-union employees, because it would alter what's in the employee handbook, which the council passed and approved, the council would have to address it if it's going to move forward as policy.
I mean, my question then, Scott, I mean, do you think you guys are going to get something worked out? I mean, we could come back in another week on this. I don't think it would be that much of an impact to wait a week, would it? Whoever can answer that.
Well, I guess I'll defer to somebody else that's a policymaker on whether or not waiting a week makes a big difference. But we always want to talk to the unions, especially because we're required to do that. We obviously would prefer to have labor peace and always work out agreements with our employee groups rather than imposing things without talking to them about it. But again, this is a decision for the Common Council to make, whether they want this to be the policy that applies to employees. And if the Common Council decides to do that, then in the City Attorney's Office and the Human Resources Department, we will work with the collective bargaining units to do what we're required to do under the law, which is bargain the impact.
Thank you very much. I appreciate it.
Alder Tate the second.
Hey, Mr. Mayor. Yeah, I think as it relates to Alder Coe's question, the discussion of like coming to some sort of agreement isn't really about the policy itself. Like they don't, none of the staff will have a say so in terms of whether this is the policy that goes forward. The collective bargaining unit will have a say so in saying like, here's how this impacts us. Let's discuss how that's resolved or compensated or whatever that may be. And that's going to happen no matter what. Because this is a policy that will impact them, they'll have the right to bargain that impact. So I think delaying it wouldn't necessarily change that reality. But I speak against deferral because of this. The two units that are mostly in people's minds for collective bargaining are also the most public facing entity that we have in our department. That's police and fire. Their only job is to interact directly with people. You know, whether that's in a crisis or a law enforcement action or some sort of community engagement, they're only interacting with people unless they're doing reporting or paperwork, which is why it's that much more important that we don't delay on having a testing policy in place, particularly with these departments that perhaps are lagging behind other city departments in terms of vaccination rates. So I think, you know, delaying this would, one, do a disservice to our community, and also do a disservice to all the departments who need to get up to speed with this so that they can continue to do the work that they're doing as safely, quickly, and reasonably as possible. I'll save some other comments for speaking to the main motion when we return to it, but for now, I'd speak against delaying this because one, it wouldn't necessarily change the reality that discussing and bargaining about the impact of the policy has to occur and will be negotiated as whether pre or post passing the policy. And two, the two entities or the two departments that have bargaining rights still are the most public facing ones. I think it would be unreasonable for us to delay in implementing this testing policy for, you know, police and firefighters because their only work is directly with people. And we want to be able to protect them as well as the people that they're working with as it relates to this virus. Thank you.
Thank you, Alder Tate the second. Alder Peterson.
Yeah, a couple of quick comments and a question for Attorney Letney. In regards to interfacing with the public, yes, the PD and the fire department are both interfacing. But as everybody stated here, they're required to wear masks, they're required to wear gloves. So, you know, if we're saying masks stop the spread of COVID, maybe that, just passed a mask ordinance to stop the spread. These guys wear protective clothing, they wear masks. So I question the extent of any possible spread if the police and fire are following the rules as laid out for their mask mandate for city employees. Question for Attorney Letney. Two questions. One, if there is something bargained or the impact is bargained and the police and fire somehow attain something in regards to the bargaining, will the non-reps get that same, whatever that may be? And two, if you guys can't come to a resolution as to the impact of the bargaining, will you not end up in arbitration?
Attorney Letton.
Well, the requirement is to bargain the impact with collective bargaining units. So by its very nature, it wouldn't apply through that process to any non-represented employees, whether there is, a decision of the council. And I don't want to speculate what some sort of agreement as to impact might be, but if the council or there's some other decision to make that apply to non-rep employees, certainly that is possible. What happens if we don't come to an agreement? I suppose it's possible, just like anybody can sue anybody they want to. Unions can grieve, can seek arbitration. I would note that the requirement under the law is that the impact be bargained. And of course, that has to be done in good faith. There is not a requirement under the law that an agreement be reached in that bargaining. So, I guess at the end of bargaining, if there's no agreement reached, and any union members or a union as a whole feels aggrieved, they certainly have the ability under the law to grieve the process if that's what they choose to do.
Alder Taft.
Hi, I just am going to speak against deferral at this point. If the rationale is that we give folks on Thursday time, I think it's, I think having clear direction about where the city's going and being able to go from that standpoint, I think is more effective and more reasonable at this point. So I think, and I also don't want to let certain groups hold up the process for the other groups that are not represented, and the safety of our constituents is paramount. And so I think I'm going to vote against deferral at this time so that folks in the meeting on Thursday have clarity and can go from there instead of continuing the uncertainty.
Alder Lemke.
I apologize. I want to speak on the main motion, but I would say that, to me, it makes sense to not defer, just because we are, as an organization, public facing and want to, do our best for the health of the community.
Thank you. Alder Coe, did you want to speak a second time, or is your hand still up from before?
Well, yeah, I just want to say, I think we've had a lot of stuff go on with the sick leave payout, and there's just a lot of distrust with the city right now. And I just think we need to start focusing on working with our employees and start getting a better relationship, because I hear a lot of stuff and it just seems like we're not doing anything to reach out with them. I understand the impact of this, I do. But I think employees might feel better if we just put out a hand and say, hey, let's try working together. That's all I got to say.
Any further discussion on the item? Okay, again, the motion before us is to defer this item, at least until this Thursday's meeting occurs. There's nobody else left in the queue to speak on deferral on this item. When the clerk calls your name, please vote as you wish.
Alder Pete,
Move to defer.
Well, the motion before you, Alder Pete, is to defer. Do you want to vote yes to defer or no
Sorry.
to defer?
Yes.
okay, Alder Coe,
Alder Coe, you're on mute.
Aye.
Alder Jones,
Yes.
Alder Tate II,
No.
Alder Santiago,
Aye.
Alder Caprillion,
No.
Alder Peterson,
Aye.
Alder Horton,
Aye.
Alder West,
No.
Alder Rouse,
No.
Alder Perez, aye. Okay, thank you. Alder Taft,
No.
Alder Mikma,
Aye.
Alder Lemke.
No.
8 ayes, 6 noes.
The motion to defer this item until after we meet this Thursday passes. That exhausts our agenda for this evening. Are there any announcements? Alder Lemke?
Can I ask a clarifying question? And if it's not in order, please just say as such, but are we planning then just to meet next Tuesday? I don't know if that's something we can discuss here or if it's premature, but.
It is premature. It's not noticed for further discussion. I'm sure we'll figure that out in the days ahead.
Okay, thank you.
Sure. Any other announcements that people would like to make not related to our agenda item this evening? Any announcements? Alder Rouse.
Yeah, I want to shout out the Venmo challenge and Stan Anderson. He's going to be over at Wilson's Coffee tomorrow at 9:40. This will be their 28th donation. They just got done donating $10,000 to the Racine Zoo. If you haven't heard of them yet, this is a great chance to see what they're about and check them out, or just check them out on Facebook. The Venmo challenge.
Thank you, Alder Rouse. Alder Coe.
Yep, I just want to tell everybody, hopefully by Saturday, I will be welcoming a new granddaughter.
Excellent.
And it's just a wonderful time for me, but thank you.
Well, and Alder Coe, I'm glad to see you survived your 65th birthday and your airplane adventure.
It was all right.
Alder Tate II.
I actually was just going to wish Alder Coe a happy birthday, since it's the first meeting that we're having since he turned the big 60, I think it was. So that's too many. We're gonna say 60.
65.
65. Okay. So yeah, happy birthday, belated birthday.
Alder Lemke.
Yes, I'm glad you survived as well. Happy birthday, Alder Coe. I wanted to wish a speedy recovery to Alder CJ Rouse, and then also wish a happy birthday to my niece Edie, and happy first day of school to so many kids that are starting.
Thank you very much. I just like to, Alder Jones has an announcement.
Thank you. Not an announcement as such, but just if everyone would keep New Orleans in their prayers. My sister lives there, and a niece and a nephew, and they are, as you know, without power, water. It's kind of a mess right now. So if you'd keep them in your prayers, I would appreciate it. Thank you. Everyone, not just my family, everyone.
Thank you, Alder Jones. Any other announcements this evening? So I'd certainly like to acknowledge and thank all the servicemen and women who for the last almost 20 years have given service to this country in Afghanistan. It's certainly a momentous time for our country this week. And I also want to acknowledge all the teachers, students, parents, staff who begin school this week under extraordinary circumstances. We really hope everyone is able to stay as safe as possible, however your education experience may take you, and encourage everyone to stay safe. That concludes our agenda for this evening, and we are adjourned. Thanks, everyone.
Have a good night, everybody.